गुरुर्देवो महेश्वरा गुरुर्साक्षात् परब्रह्मा तस्मै श्री गुरुवे नमः तस्मै श्री गुरुवे नमः तस्मै श्री गुरुवे नमः.
Very warm good evening to one and all. On behalf of Sameeksha, I invite you all for the today's session. We know that Sameeksha is an organization started by many of doctors and house surgeons with the aim of developing the knowledge of Ayurveda in a way that is accessible to all physicians for the advancement of Ayurveda around the world. From the very first step of Sameeksha on the subject of nervous system, we were made aware of the importance of nervous system in Ayurvedic treatment. The associated gynecology, obstetrics and Ashwagandham classes received a lot of attention. Similarly, our international seminar also received a lot of attention. The single session we conducted was very focused on the upliftment of BAMS students, clarifying job opportunities outside India, information on what to do for the MOH exams and completely dispelling the doubts of many related to it. In addition to these seminars, several cases including photos were presented to make it easier for our growing young doctors to understand the treatment of diseases in each condition. Details of our seminars are displayed on the screen. Those who wish to watch these seminars can send a message at any time to the WhatsApp number displayed on the screen for the recordings of seminars. Let us go to today's class to learn more about becoming a good doctor by praying to Jagadishwar that he will bless all our Ayurvedic doctors to excel in the field of treatment.
Good evening, everyone. Team Sameeksha presents Vatakandaka, a national level paper and poster presentation. And today, the final session will start within few minutes. And before that, let me invite our respected panel members and dear participants. Before get start, please follow the rules. You have maximum of 8 minutes. So without much ado, we can start the session. And first, I invite Dr. Anushri CG for the paper presentation. I invite Dr. Anushri CG. Doctor, please unmute. I invite Dr. Anushri.
Am I audible, ma'am?
Audible, yes, doctor.
Is screen is visible?
It's sharing, doctor.
Is it visible, ma'am?
Still it is sharing, doctor. Hello, doctor.
Dr. Anushree,
Ma'am.
Doctor, you have any problem with screen sharing?
Wait.
Hello, Dr. Anushree, if you have any problem with screen sharing, I will share for you, doctor.
One minute, sir.
Hello, Dr. Anushree, are you there?
Yes, sir.
Doctor, if you have any problem with screen sharing, I will share for you, doctor.
Dr. Anushree.
Dr.
So next
Aishwarya
I
List.
invite.
Okay, doctor, please continue.
So next I invite Dr. Ashwini Ashok Rao for the paper presentation.
Yes, ma'am. Am I audible, ma'am?
Yes, doctor.
Can you please share my
Please share the
PPT,
screen.
please?
Okay, doctor. Dr. Sabin.
1 minute, doctor. Doctor, please, doctor.
Sir, it's actually Pooja Dhage PPT. My PPT is on the name of Dr. Ashwini Parikhi.
1 minute, doctor. Doctor, is this your PPT? Hello, Dr. Ashwini.
Yes, sir. Thank you, sir. Yes, sir. So myself, Dr. Ashwini Parki. My topic name is I am from Yashwant Ayurvedic College. Can you start? Hello.
Yes, doctor, it's audible. Please continue.
Okay. Okay. Thank you. My topic name is vulnar keratoconjunctivitis, a severe allergic diseases. Abstract. Vulnar keratoconjunctivitis is unusually a severe sight-threatening allergic disease occurring mainly in children. The proper treatment must be given to these children. As untreated VKC can lead to permanent visual loss, pediatric allergists should be aware of management of and the therapeutic option for this disease to allow patients to enter clinical remission with the least side effects and the sequel. It's chronic form of extra allergy that can potentially cause severe visual complications and in mainly children and in young adults. The next slide, please. Introduction. Ocular allergy can involve all of the components of ocular surface, including the lid with margins, conjunctiva, and the lacrimal system. Various clinical forms are included in the classification of ocular allergy. Seasonal allergic conjunctivitis, persistent allergic conjunctivitis, vulnar keratoconjunctivitis, atopic keratoconjunctivitis, which requires particular treatment for them. The term allergic conjunctivitis refers to the collection of hypersensitivity disorder that affects lid and conjunctiva. Next, among the different varieties, allergic conjunctivitis, EKC is the most troublesome, wherein the child suffers from intense itching, lacrimation, and was during the
Hello, Dr.
pathogenesis.
Ashwini.
Yes,
Hello,
ma'am.
Dr. Ashwini. Doctor, your
Ma'am.
voice is not clear. Doctor, please reconnect your headset.
Actually, ma'am, I am in headset, but I am in a traveling, ma'am.
Okay, doctor.
That's why
Please continue.
sound is disturbing.
Your voice is very much like cracking.
Can you
Yeah. Please continue. Please continue.
okay. Shall I continue?
Yes, doctor.
Hello? Okay.
Yes, doctor. Please continue.
Okay. In pathogenesis, tissue remodeling reaction, capillary formation of different sizes and shapes, stem cell efficiency, and the various degrees of superficial corneal opacification are further consequences of fluid inflammation. Many elements contribute to this dramatic response, including epithelial changes, connective tissue deposition, edema, inflammatory cell infiltration, and the glandular hypertrophy. The next classification, it is mainly a three types, palpebral, lingual, and the mix. In palpebral, it involves upper tarsal conjunctiva and be associated with the corneal disease. It is characterized by conjunctival hyperemia and diffuse velvety capillary hypertrophy on the superficial tarsal plate. In limbal, most common in African and British children, the horror trends dots on the limbal area. In mixed, having the features of the both palpebral and the limbal leakage. The next is in Ayurveda, leakage the skin tetra is very similar to the Kapha Chandra. As per Ayurveda, leakage most appear in Vasanta Ritu. As in Vasanta Ritu, there is a cough prabhu, and in childhood, there is also a cough prabhu. So it is can be related to VKC, which is the most occur in summer, and it is characterized by swelling, itching in eyes, along with the profuse, thick, creamy, white discharge. Chalakya Tantra Kriya Kalpa is prescribed for the Netra Chikitsa for the treatment of first type of eye disease having a latent dramatic values, that is the Krishnadi answer. The next is in management. General measures in allergen avoidance, cold compress, ear hygiene, and the bandage of bandage contact lenses. Local treatment, mask and stabilizer. Loperamide Sodium chromocyclate reduces the frequency of acute exacerbation and the need of steroid. Topical antihistaminic, imidacine and epinephrine, when used in isolation, are above effective as a mass stabilizer. They are suitable for the acute exacerbation and the trial of several different agents may be worthwhile. So next please. Combined antihistamine and the vasoconstrictor may offer relief in some cases. Non-steroid anti-inflammatory preparation after ketorolac like diclofenac may improve the topical steroid, fluramidinol 0.1%, prednisolone 1%, rotiprednisolone 0.2% use of the severe exacerbation of conjunctivitis and the significant keratopathy. Antibiotics to prevent bacterial infection, immunomodulator, cyclosporine, calcium inhibitor. The next in systemic treatment, oral antihistaminic helps with the itching, nocturnal therapy. Antibiotics, doxycycline 5 to 100 mg, azithromycin 500 mg, immunosuppressive agents, steroid, cyclosporine, and the azithromycin. Surgery, superficial keratectomy may require to remove the plaque or the damaged shield ulcers. So next, these are the references of the vacancy, and thank you.
Thank you, Dr. Ashwini. And Dr. Anushree, are you there?
Yes, ma'am.
Doctor, please start.
Ma'am, can you share the PPT?
Doctor, if you have any problem, then Dr. Sabin will share for you.
Yes, ma'am. It's
One minute,
not
doctor.
sharing.
I will share, doctor. 1 minute.
Okay, okay.
Okay.
Doctor, please start the session, doctor.
Good evening, everyone. Myself, Dr. Anushree CG, final year PG scholar, Department of Agada Tantra, SDM, College of Ayurveda, Hassan, under the guidance of Natlats HR, Associate Professor, SDM, Hassan. Hridayavarna is one among the Chaturvamshati Upakrama, and it is said as it is the first aid in case of the Visha. Next slide. Next slide, sir. So coming to the Hridayavarna, definition is Hridayavarnam Hridaya Rakshakaram Aushadam. As Chakrapani says that Hridayavarna is the method of Rakshana of Hridaya by using certain Aushadas. Tikshnata of Visha makes the Karshana of Hridaya. So for the protection purpose, Hridayavarna should be done. Next slide, sir. So, coming to the introduction of Hridaya, Hridaya is the seat of Sadhaka Pitta, Pranavata, Manas. In case of poisoning, protection of vital organs such as Mastishka, Hridaya, Pupus are very important. If these organs are affected by the poison, then death is sure. Hence, protection of these vital organs are important. Next slide, sir. So Hridayavarna is the 13th Upakrama mentioned among the Chaturvimshati Upakrama according to Charaka. So Hridayavarna, it acts as a covering membrane over the vital organs, and it is the first aid in case of the acute snake bite. In Kritrima Visha, it acts as a therapeutic procedure and preventive purpose. Next slide, sir. So most of the medicines are having the Gruta based, which are having the antitoxic and ojovardhaka properties, and hence it is having the capability of entering into the blood-brain barrier, and hence may aid to preserve the higher mental functions. Next slide, sir. Sthana of Hridaya is, it is situated between the sthana called as Amashaya Dvara. Sangatana is, Hridaya is made up of Prasada Bhaga of Shonita and Kapha in the 4th month of pregnancy. Next slide, sir. Akara of Hridaya is like a Kamala, and doshas are, and there will be Pranavata, Udanavata, Vyanavata, Avalambaka Kapha, and Sadaka Pitta. And Hridaya is also having the type of ojas, that is Ashtabindu ojas, and the Trigunas are present, Manas and Atma. Next slide, sir. So, what this Visha does to the Hridaya means, according to Ashtanga Hridaya, Visham Karshati Tikshnatvat Hridayam Tasya Guptaya means because of the penetrating action, poison weakens the heart, and Tato Hridaya Mastaya Dehu Chedaya Kalpate means poison when enters the body, vitiate the blood, and Kapha, Pitta, Vata, then it invades the heart and leads to the death. And it also affects the ojas, that is ojaso viparitam tat tikshna dhairanvitam gunaihi vata pittottaram nrinam sadhyo harati jivitam. Next slide, sir. So, Visha is having the opposite action of the ojas because of the properties of tikshna, etc. It takes away the life of a person which is having the predominance of vata and pitta. Next slide, sir. As I said, Visha and Ojas are opposite. Visha gunas are Tikshnoshna Ruksha Vishadam Yava Yashukaram Lagu Vikasi Sukshmam Avyaktam Rasam Visham Apakija. Its opposite is Ojas, that is Guru Shitam Rudush Lakshna Bahalam Madram Sthiram Prasannam Pichilam Snigdam Ojo Dashagunam Smritam. Next slide, sir. So I have mentioned that is Visha gunas are opposite to Oja gunas. Next slide, sir. So yogas mentioned for the Hridaya Varnas are based on the Gruta based, that is Pibet Grutam Grutak Shodram Magadam Va Gruta Plutam Hridaya Varnam Chasya Shleshma Hrudya Pachayate means a patient should drink either ghee or mixture of ghee or the honey or anti-poisonous recipe mixed with ghee. By this Hridaya Varna, kapha gets increased in the heart. Next slide, sir. So importance of Gruta is Na Grutam Sramsanam Shastam Pralepo Bhojya Moshadam Sarveshu Sarvavasteshu Visheshuna Grutopamam Vidyate Veshajam Kinchit Visheshat Prabale Anile means Virechana Pralepo Bhojana Aushada without the addition of ghee is not suitable in the treatment of poison. So there is no medicine better than the ghee in all kinds of poison and in all stages of poison, especially it is best when Vata is powerful. It also said that Shuddha Hridi Tata Hema Churnasya Dapayat means Hema Churna can be given to protect the Hridaya. Next slide, sir. And also Panchagavya can be given Kovidara Patrakalka, Chaga Rakta, Majja Gomaya Basma, Krishna Mritika with Panchagavya or Dadi can be given as a Pana. In Bala Garbini Vruddha, Chaga Rakta, Mahisha, Varaha, Shasha, Kshira with Vishara Dravyas of Shita Virya can be given. Next. Ajaya Grita, it is also given to protect the heart. It contains Madhuka Tagara, Krishna Badradaru, Harena, Manchista, Yelavali, next to Nagapushpa, Utpala, Plava, Vidanga. Like this, drugs are made into paste and cooked with ghee. When administered, destroys the effect of all kinds of poison quickly. Next. Amrutagrita also given 2 Shweta, 2 Kapota, Pratyak Pushki, Shirisha, macerated with Gomutra, cooked with Grita. It destroys the effect of poison quickly. So, ojas may be correlated with CSF in brain. This helps to cross the blood-brain barrier. Hence, it can prove that Hridayavarna not only protecting the heart but also CNS. Next slide, sir. So, qualities of geese are Madhura Saumya Mrudu, Shita Virya, Snehana Ojo Vardaka Balakara, Ayushya Vrishya Vayastapana. Next slide, sir. Next slide, sir. And it is a Vishahara Rakshogma Chakshusha Unmada Nashaka. Next slide, sir. Next slide, sir. So in Upadrava, it is seen that Pravritta Gaurava Utklesha Hrillasa, and this leads to the Shleshmupachaya. For this, we have to do Vamana, but devoid of Kanjika, Kulata, Madhya, and Taila. Next slide, sir. In modern view, venoms mainly contains the peptides and proteins. So it is having the 2 main functions, that is to capture and to serve as a defense. Next slide, sir. So, when it comes to the sodium channel, in sodium channels, these are the essential part of the excitable membranes and enables the fast depolarization, and then it leads to the action potential degeneration and cardiomyocytes and some parts of the conduction system of the heart. So when toxin enters, next slide, sir. Next slide, sir. So it forms the low density in SA node and AV node cells and highest in Purkinje cells and cardiomyocytes. These are targeted by the neurotoxins from the plants and animals. Then it leads to the cardiac arrest. Next slide, sir. Next slide. So in calcium channel also we have two types, L and T type. This L type is responsible for the prolonged AP, that is action potential in cardiac muscle cells, and it acts as a cardiac muscle contraction by the target of some bacterial and animal toxins. Next slide, sir. In potassium channel also, role of potassium is to repolarize the membrane during the action potential and regulation of duration of AP. When toxin enters the heart, it changes in functioning, causes the life-threatening arrhythmias. Next slide, sir. So therefore, potassium channel can be the target of the natural toxins or the calcium activated potassium channels and voltage gated potassium channels. Next slide, sir. Next slide, sir. Next slide, sir. So, ghee as a cardioprotective in modern classics of toxicology also mentioned ghee to protect the heart in the treatment of poisoning. Among the physical antidotes like fats, oils, milk, egg, albumin are mentioned. Ghee, being an animal fat, comes under this group as antidote. This group of substance delay the absorption of poison. They basically form a coating over heart and prevent the absorption of the poison. Next slide. Next slide. So in discussion, the word Hridaya is not only for heart, it also contains the various dosha, dhatu, manas and atma. The drugs like Gairika, Ikshu, etc. used in Hridayavarna are Ojovardhaka, Pitta, Shamaka, and the rate of spreading is slow. So Vagbata mentions a Visha Sankata and the factor that increases the spreading of poison in Pitta Prakriti. The Ushna Guna of Pitta and poison are same. Hence, the spreading of poison in Pitta Prakriti patient is very fast. Next slide, sir. Conclusion, all acharyas were aware of importance of vital organs and their protection in case of poisoning. Hridayavarna is the most important chikitsa upakrama as it acts as protection of all vital organs in the body in case of visha. Thank you.
Thank you, Doctor. Next, I invite Dr. Purnima for the paper presentation. I
Hello.
invite Dr. Purnima.
Yeah, I'm there.
Hello, Doctor.
Hello. Am I audible?
Yes, you're audible. Please
Yeah.
start.
I don't have the share option here. Can you allow me to share the screen?
1 second, Doctor. Dr. Sabin.
1 minute, doctor. Doctor, you can share, doctor. You can share now. Please click
Okay,
share
yeah.
screen and click
Yeah.
screen option.
Yeah. Whether my screen is audible now? Like visible now?
Not visible, doctor. You're audible. Please click
Okay.
share screen option and click screen.
Okay. Yeah.
Okay,
I
doctor.
think
Now
it
it's
is
okay. Sharing,
visible.
doctor.
Okay. Yeah.
Please chat the session, doctor.
So, good evening, everyone. I welcome you all for my paper presentation with titled a double-arm, open-label, randomized clinical study on the effect of Trivikrama Rasa in the management of cholelithiasis. The aims and objective of the studies were to assess the effect of Trivikrama Rasa on cholelithiasis symptomatically and to know the size or reduction in the size of the cholelith by USG. So to introduce, as we all know, the cholelithiasis is the most common surgical disease found in the surgical practice, and it ranks the top 4 common among the abdominal surgeries. So the treatment advised is prophylactic cholecystectomy without showing the much supporting evidence to prevent the gallbladder cancer. Hence, this study was conducted to know the efficacy of Trivikrama Rasa, which is Ashmari Hara in property, and it reduces the cholesterol levels in the blood, which is used in dyslipidemia. Hence, the drug was chosen along with the Kokilaksha Kshara and Palatrikadi Kashaya as Anupana for Kshara. So the materials and methods of this study were, the source of data was from a hospital, JSS Ayurveda Medical College, and the method of collection was all the patients aged between 20 to 65 attending the OPD of and IPD of JSS Ayurveda Medical College were selected, and the sampling was done with the subjects 26 in Kokilaksha Kshara and 27 subjects in Trivikrama Rasa. One was dropped out, and after taking the consent, the diagnostic criteria was considered to be the pain in right upper quadrant of the abdomen, referred pain to the inferior angle of the right scapula, vomiting, nausea, flatulent dyspepsia, recurrent indigestion, and USG of the abdomen showing the calculi of the gallbladder. All these diagnostic criteria were considered as the subjective and objective criteria along with the diagnostic criteria. To include in the study, I had taken the patients between 20 to 65 as told, and with the gallstone size of 3 to 12 mm. Above the 12 mm is considered to be the more riskier for the developing gallbladder CA. Hence, the study was conducted between the 3 to 12 mm, and patients presenting with all the diagnostic criteria as mentioned before. And in patients satisfying minimum 2 was considered for the inclusion criteria and was taken for the study. And the exclusion criteria considered was the gallstones with complications such as acute obstructive cholecystitis, acute pancreatitis, liver failure, CA of the bladder, and immune compromised patients and other systemic disorders were excluded for the study. So the lab investigations which are conducted was just to rule out the diabetes, FPS, PPBS, HbA1c, and lipid profile before and after the treatment to know the effect of the Trivikrama Rasa, and the USG abdomen before and after the treatment. Among these, the USG abdomen before and after treatment was the objective criteria. So the drug procurement was done with the Trivikram Rasa was purchased from the Vargo company, which is the GMP certified company, and it was made into sachets of 125 mg, and it was advised twice a day for the patients to take with water. And the Kokilaksha Kshara was procured from VHCS company, which is a GMP certified company, and was the powder was made into capsules, measuring weighing around 300 mg, and was advised twice daily along with Falatrikadi Kashaya, which was procured from Sadvidya Shala and was advised 15 ml twice a day. So these are the photographs that you can appreciate. And then the study design was done as a randomized clinical study dividing into 2 groups, and the period of the study was 30 days and follow-up period was 30 days. Then the assessment criteria, as I told you, the subjective parameters were all the symptoms of diagnostic criteria, and the objective criteria was USG of the abdomen with the size and number of the calculi. Coming to the observations and the results, the group A, that is Kokilakshara, showed significant results clinically in reducing the pain in the upper quadrant of the abdomen, referred pain, vomiting and nausea, flatulent dyspepsia and recurrent digestion with significantly high value. Then in objective criteria, the cololith was reduced to 1 mm or 0.5 mm or 3 mm, up to 3 to 4 mm was dissolved. So the significance was statistically, it was p-value was 0.006. Then coming to the Trivikrama Rasa, the subjective parameters like pain in upper quadrant, referred pain and vomiting was reduced, and which was clinically and statistically significant. But the nausea, flatulent dyspepsia and recurrent indigestion were not much appreciated clinically, and it was in same was with the statistically the p-value were not significant, but the objective parameter USG abdomen showed p-value of 0.002, which is significant, again highly significant, with the good result in the dissolution of the cholelithiasis. So this study was mainly carried out and was funded by RGHS, Rajiv Gandhi University of Health Sciences. It was funded by the RGHS, and it was studied just to know the effectiveness of the oral dissolution therapy present in Ayurveda. So this study showed promising result, and it gives a ray of hope for the medical management of the cholelithiasis. So Trivikrama Rasa, as I told you, it is effective in dissolving the cholesterol stones, and it has better patient tolerance, and it is easy to procure, and at the same time it is affordable to the patients. So the Trivikrama Rasa is a well-known drug for the management of dyslipidemia, and cololith, being rich in cholesterol, might have reduced the stone size rather than reducing the flatulent dyspepsia or recurrent indigestions. Then Kokilakshara, along with the Falatrikadi Kasha, fared better than the Trivikrama Rasa. Clinically, this could be attributed that Kshara has the Chedya, Bhedya and Lekhe properties for the dissolution of the calculi, and when it is used with the combination of the Falatrikadi Kashaya, it reduced the flatulent dyspepsia and recurrent indigestions also. So to conclude, there is a great need for oral dissolution therapy for cholelithiasis, which is purely a surgical disease. In this direction, this clinical study has shown effective dissolution of the stone without surgery. Thank you. These are the references. Thank you.
Thank you, doctor. So next I invite Dr. Sainath Maruti Bhosle for the paper presentation. I invite Dr. Sainath.
Is I am audible?
Yes, doctor.
Hello.
You're audible.
I'm not able to share my screen. Please help me.
Okay, doctor. Just 1 second. Dr. Sabin.
1 minute, doctor.
Hello.
Hello, doctor. We will call you on after next, doctor.
Hello.
So next, doctor. Doctor, you can present
Hello.
next.
Hello.
So next, hello, Dr. Sainath. Dr. Sainath, am I audible?
Yes, you are audible.
Dr. Sainath, you can present next. Doctor, you can present next. Please be there. So next I invite Dr. Poonam R. Gupta. I invite Dr. Poonam R. Gupta. Hello, Dr. Poonam. So next I invite Dr. Shubham. Dr. Shubham. Hello, Dr. Shubham. Hello, Dr. Shubham. Please respond. So next we have a poster presentation. Okay, Dr. Shubham. Hello, Dr. Sabin.
Hello, doctor.
Please let Dr. Shubham, he want to say
Dr.
something.
Shubham, can you hear me? Hello, Dr. Shubham, can you hear me? I think it has some network issues. Doctor, please call next person.
Hello. Hello, doctor. What about Dr. Sainath? Can I call you next? Call him next.
1
Dr.
minute,
Sabin.
doctor.
So next we have a poster presentation.
Hello. Hello.
Doctor.
Hello.
Doctor, please
Please
be
will
there.
you help me to share my screen?
Yes, doctor. Please be there. You can present soon. Dr. Kalyani.
Yes, ma'am.
You can present now.
Yes, ma'am. Good evening, ma'am. Am I audible, ma'am?
Yes, doctor.
Yes, ma'am. Is my screen is visible?
Not visible,
No,
doctor.
doctor.
My screen is visible or not, ma'am?
Not visible, doctor.
Sir, can you share it for me, sir?
Hello, Dr. Sabin.
Doctor, we will call you on after next, Dr. Kalyani.
Myself, Dr. Sai, I am able to share my screen, please.
Yeah, sure, doctor. Please.
Is it visible for screen?
No, doctor. Doctor, your screen is not visible. Please share.
Or I am still not able to share it. Sorry.
Okay, doctor, it's okay. You can present later. So next I invite Dr. Shivani Vivek for the paper presentation.
Yes, ma'am.
Okay, doctor.
Just a minute, ma'am. I'll share my screen. Ma'am, can you see my screen now? Hello.
Yes, it was visible, but it's not now. Now it's not visible, doctor.
Just a minute, ma'am. Is it visible now?
Your screen.
Is it visible, ma'am, now?
Yes, it's now.
Okay.
Please select that doctor. It's okay now.
Okay. Good evening, everyone. I'm Dr. Shivani Sonone. I'm from College of Ayurveda and Research Center, Pune. My department is Rog Nidan. My topic for presentation today is Avastha Pak. The process of formation of nutritious content from the food is called as avasthapak or prapak. During the process of avasthapak, the food is continuously under transition, and the last transition is called as the prapak. Uh, uh, the digestion of food is divided into three stages, which is mentioned as avidagdha kapha pittam vidagdham pavanam punaha samyak no nisara aharah paripruhatyet. The avasthapaks are divided into three stages, that is the pratham avasthapak, dvitiya avasthapak, and tritiya avasthapak. Pratham avasthapak includes avidagdha avastha, which has kapha dosha in majority. That is it is also called as the madhur avasthapak. Dvitiya avasthapak is also called as the vidagdha avasthapak, and it is also called amla avasthapak. Tritiya avasthapak also called as pakva avastha or katu avasthapak. First, let us go through pratham avasthapak. Pratham avasthapak is mentioned, is quoted as annasya bhukta matrasya षडरसस्य प्रपाकात् मधुरद्यात कफो भवात फेन भूतस्य उदीर्यते. When the food is just there is intake of food, this is called as the madhur avasthapak or the first avasthapak. This is avidagdha avasthapak. The organs included in this avasthapak, that is first avasthapak, is right from the oral cavity to the stomach, that is amashay. The duration of this avasthapak is around 3 to 4 hours. The panchabhautik vighatan included is prithvi and jal. The doshas included is kapha dosh, and the symptoms in first avasthapak are mandata, susti, alasya, madhurta, and trupti. The next avasthapak is the dvitiya avasthapak, also called as the amla avasthapak or vidagdha avastha. It is quoted as परम तु पच्यमानस्य विद्धस्याम्ल भवातः आशयाच्च अवमानस्य पित्तमुच्छम उदीरते. This avasthapak takes place at the grahani, that is the duodenum. And the duration of this avasthapak is around 6 to 6.5 hours. The panchabhautik sanghatan includes the agni mahabhuta, the dosh is pitta, and the symptoms are daha in this avasthapak. The third avasthapak, that is the katu avasthapak, is also called as pakva avastha. It is quoted as pakvashayam tu praptasya sheshamanasya vanhinam paripindita pakvasya vayu syata katu bhavat. In this katu avasthapak, it takes place in the pakvashay, and the duration of this avasthapak is 12 hours. The panchabhautik sanghatan included is vayu and akash, and the external symptoms are utsaha and agni sandhukshan. All the three avasthapaks are mentioned in this chart: the madhur avasthapak, amla avasthapak, and katu avasthapak. As mentioned above, the first avastha, that is pratham avastha, it takes place in the amashaya. Its kal is 3 to 3.5 hours. Its panchabhautik katva is prithvi and jal, rasa utpatti is madhur, and dosha utpatti is kapha. In Dvitiya Avasthapak, it takes place at the Grahani. The Kal included is 6 to 6.5 hours. It has Panchabhautik Vigatan of Tej and Vayu. Rasa Utpatti is Amla, and Dosh Udirit is Pitta. Sharir Drushya Lakshan is sometimes Alpa Pramanat Antakosha Daha is seen. The Tritiya Avasthapak takes place in Pakvashay. The duration is 12 hours. Panchabhautik Vighatan is Akash. Rasa Utpatti is Katu. And Dosh Udarit is Vayu. And external symptoms are Utsaha and Agni Sandhukshan. Now, how this plays a role in treatment is the specific avasthapak, specific time, and specific dosha play an important role in treatment. If for example, if there is pain, that is udar stool after intake of food, we can look that during what which part of digestion the pain is taking place, and we can consider the avastha pak accordingly. The next is Sarakitta Vibhajan. After the at the end, as a result of the digestion, ahar is absorbed as sar and excreted as kitta. The absorption is done in the villi in the intestinal wall. The last is Vipaka. The final product after complete digestion of food is called as Vipaka. Acharya Chakrapani has mentioned that in Avastha Pak there is Tridosha Vruddhi, and in Nishtha Pak that is Vipak, there is Tridosha Vruddhi along with Mala formation. There are references quoted by quoted by Acharya Charak and Vagbhat, which mention the types of Vipaka. Acharya Charak and Vagbhat have mentioned three types of Vipaka. Katu Tikta Kashayanam Vipaka Prayashah Katu Amlo Amlam Pachate Swadu Maduram Lavanastha. In this, Acharya suggests that the rasa, that is Madhur and Lavan ras form Madhur Vipak, Amla ras form Amla Vipak, whereas Katu, Tikta and Kashai ras form Katu Vipak. Whereas Acharya Sushrut mentions two types of Vipaka, uh, Vipaka. Madhur Vipak, this is Madhur Vipak, it is Kafakar, and on Dhatu it works as Shukral. And on Mala, its work is Shrushta Vinmutro. Amla Vipak is Pittakar, and its action on Dhatu is Shukranashan, and its role on Mala is Shrushta Vinmutra. Katu Vipak is Vatakar and Shukraha, and its work on Mala is Baddha Vinmutra. Thank you.
Hello, ma'am. I'm
Thank you,
Dr.
doctor.
Can I try again?
Okay, doctor, we will call you, doctor. Please
Okay,
wait,
sir.
doctor. Next, I would like to invite Dr. Sainath for the paper presentation. Dr. Sainath, are you there? Hello, Dr. Sainath, are you there? Hello, Dr. Sainath, are you there? Okay, next I would like to invite Dr. Poonam R. Gupta for the paper presentation. Dr. Poonam R. Gupta, are you there? Hello, Dr. Poonam, are you there? Okay, next I would like to invite Dr. Shubham for the paper presentation. Dr. Shubham, are you there? Hello, Dr. Shubham, are you there? Okay, next I would like to invite Dr. Kalyani. Dr. Kalyani?
Yes, sir. Yes, sir. I'm here.
Okay, doctor.
Sir,
Please
can
share
I
the
share
screen.
my
Sure,
screen?
doctor. Please share the screen, doctor. Please share.
Okay, sir. Okay, sir.
Hello, Dr. Kalyani.
Yes, sir.
Doctor, you have any problem with screen sharing?
Yes, sir.
1 minute, doctor. I will share for you, doctor. 1 minute.
Okay, sir.
Dr. Kalyani, please
Yes, sir.
start the session, doctor. Is this screen is visible, doctor?
Yes, sir. Yes, sir.
Okay.
Sir, can I start, sir?
Sure, doctor. Please start the session, doctor.
Okay, sir. Sir, screen is not visible again, sir.
Doctor, is the screen visible?
No, sir. Yes, sir. Yes, sir. Can I start, sir?
Please start the session, doctor.
Ayurvedic management of lifestyle disorder, obesity. The Samprapti is obstruction of stotas by Meda, Vat confined to Koshta. Then it stimulates digestive power and increased absorption of food. Then quick digestion and increased hunger. Then Staulya causes. Then causes of the Staulya. Excessive intake of heavy, sweet, cold, and fatty diet, lack of physical exercise, sleeping during the day, uninterrupted cheerfulness, lack of mental activities, hereditary and genetic effects. The management of the obesity is Vat, Kapha, Meda elevating food, enema with Ruksha, Ushna, and Tikshna drugs, Ruksha Udvartan, Guduchi, Bhadra Musta, and Triphala Churna can be used. Then then honey, then Yava and Amalki Churna, Bilwadi Panchamul plus honey, Sheila Jatu and Agni Mantha plus honey, and physical and mental exercise can be done. Then सममांस प्रमाण सहस्तु समसंहननो नरः दृढ़े इंद्रियो विकाराणाम न बलानि विभूयते. Thank you, sir.
Thank you, doctor.
Thank you, sir.
Next, I would like to invite Dr. Raghuram for the paper presentation.
Yes, sir.
Dr. Raghuram.
Yes, sir.
Doctor, your screen is visible, doctor. Please start the session, doctor.
Good evening, everyone. Myself, Dr. Raghuram, second year PG scholar from Department of Travaguna, Rajiv Gandhi Medical College, presenting plant of versatile properties, a review of Jeeraka under the guidance of Dr. Shashi Kalavani, Professor and HOD Department of Travaguna, Rajiv Gandhi Medical College. Introduction. Jeeraka is a slender annual plant, belongs to Umbelliferae family. Jeeraka is one of the multi-dimensional drug mentioned in classical literature. It has been used as therapeutic agent for treatment of different diseases. It contains various important phytoconstituents such as cuminaldehyde, thymine, and terpenoids, etc. The present review is an attempt to generate interest regarding immense potential in preventing and treating several common diseases. Historical reference of Jeeraka is found in Sushruta Samhita, Charaka Samhita, Ashtanga Hridaya, Bhava Prakasha Nigantu, Dhanvantari Nigantu, Payyadeva Nigantu, Madanapala Nigantu, Raja Nigantu, etc. Taxonomical classification. Kingdom Plantae, subkingdom Stratophyta, superdivision Spermatophyta, division Magnoliophyta, class Magnoliopsida, family Umbelliferae, genus Cuminum, and species Cuminum simium. Description of Jeeraka. Jeeraka is normally a biennial and multi-branched herb, 35 to 70 centimeter in height with a narrow, finely grooved leafy stem. It produces a deep taproot and finely cut feathery leaves. It has a high vernalization requirement to initiate the production of flowering stems in second year, which grows to a height up to 75 centimeter. The flowers are produced on umbels which are white and 2 to 3 millimeter across. The outer ones are larger than the inner ones. They open from late April onwards and are succeeded by fruits which are 3 to 6 millimeter long and light brown, ripening from early June and July. Cultivation and propagation. Cultivation of cumin requires long hot summer of 3 to 4 months with the daytime temperature around 30 degrees Celsius. It is drought tolerant and is mostly grown in Mediterranean climates. It is grown from seeds sown in spring and needs a fertile, well-drained soil. Uses culinary use as well as medicinal use. Chemical composition. The major compound occurring in jeeraka, various extrapinin, limonene, terpene, and linalool. The seeds and root contains acetaldehyde, cuminic aldehyde, dihydrocarovolol, beta-pinene, ethiol, beta-carolphylline, sabinin, berylyl alcohol, camphanin, philandrine, and thymol, in addition to glycolides and flavonoids. Tikshnoshnam katukam pake, rucham pittagni vardhanam, katushleshma nirharam, gandhadyam jeerakadvayam. Jeeraka is pungent in taste, hot in potency, improves taste perception, stimulates the digestive fire, and promotes the digestion. It is fragrant, improves intellect, elevates kapha dosha and vata dosha. Other properties are Rucha, Deepana, Grahi, Medhya, Jwaragna, Pachana, Vrishya, Balya, and Chakshusha. Other uses as per classical literature. Gulma, Admana for Atisara, Grahani, Krimi, Chardi, Pushta, Visha, Jwara, Garbhashaya, Vriddhikrita. References from Bhava Prakasha Nigantu. Pharmacological uses. Antioxidant and antimicrobial. The antimicrobial action of cumin, both oil and aqueous, has assessed against a wide range of valuable and pathogenic gram-positive and gram-negative microbial strains. Cumin seed, oil and alcoholic extract inhibited the growth of Klebsiella pneumoniae and its classical isolates and caused improvement in cell morphology, capsule expression, and decreased urease activity. Cumin has also found the biofilm formation, preventive properties against streptococcus and carcinogenic. Cumin and black pepper may protect the colon by decreasing the activity of beta-glucuronidase and mucinase. Histopathological studies also showed lesser infiltration into submucosa, fewer papillae, and lesser changes in cytoplasm of the cell in the colon. Colon cancer was induced in rats by subcutaneous injection of DHM. The rats were continued with the standard pellet diet and supplement of red chili, cumin seeds mixed with diet and black pepper throughout the experimental period. After the total experimental period of 32 weeks, the incidence and number of tumors in colon were observed significantly higher in the rats administered DHM as compared with cumin plus DHM and pepper groups. And oral administration of cumin showed hypoglycemic effect in normal rabbit, resulting in significant decrease in the area under the glucose tolerance curve. Hyperglycemic peak. The biologically active constituent cuminaldehyde inhibited aldose reduced and alpha glucosides isolated from rat. In hyperglycemia, when administered cumin by orally to alloxin, induced diabetic rats reduced the body weight, plasma, and tissue cholesterol, phospholipids, free fatty acids, and triglycerides, and also decreased AST, ALP, and GGT activities, and decrease the tissue level of cholesterol, triglycerides, and phospholipids. Immunomodulatory. The oral treatment of cumin stimulated the T cells expression in normal and cytosporine and induced immune suppressed animal. Cumin also depleted T lymphocytes, decreased the elevated corticosterone level and size of adrenal glands, and increased the weight of thymus and spleen in stress-induced immune suppressed mice. Central nervous system. The administration of cumin oil decreases the frequency of spontaneous activity induced by maximal electroshock, PTZ, in mice in time and concentration dependent and increased duration manner. Cuminaldehyde has tyrosine inhibitor property that prevented the oxidation of dopa. Anti-osteoporotic activity. The presence of phytoestrogen in cumin has shown the anti-osteoporotic effect of reduced the urinary calcium excretion, augmentation of calcium content, and mechanical strength of bones. Other biodynamic activities are cumin has also shown antitussive and produced a relaxant effect by stimulating beta adrenoreceptors or histamine H1 receptors. Important formulations are Ingvastaka Churna, Dhatri Rasayana, Jirakarishta, Yogaraja Gugulu, and Jirakale. Jiraka is an important herb in Ayurvedic literature as it's been used in treatment of as well as culinary purpose as ahara. The most important biological properties as mentioned in classical literature as well as properties discovered versatility of the drug. Even though there are many herbal plants in the world, Jiraka is considered as one of the best drugs, having greater medicinal as well as culinary value. For the last few years, Jiraka has been one of the most exported spice as an increasing demand. Quite a significant amount of research has been already carried out during past few decades in exploring the chemistry of the Jiraka. Thank you.
Thank you, Doctor. Next, I would like to invite Dr. Lakshmi for the paper presentation. Dr. Lakshmi, are you there? Hello,
Yes,
Dr.
sir,
Lakshmi.
I am here. Yes, sir.
Okay, Doctor.
Okay. Can I share my video?
Okay, Doctor. Please share the screen. Your screen is visible, Doctor.
Okay.
Please start the session.
Good evening, all. Myself, Dr. Lakshmi A.G., second year PG scholar, Department of Swasthavrata, SDM College of Ayurveda, Hassan. Today, I am going to deal with the topic, role of arrowroot gruel in the management of inflammatory bowel disease, a case report under the guidance of Dr. Shivakumar and Dr. M.B. Kavita. Need for the study. Arrowroot is a source of unconventional starch that is known to have various therapeutic benefits. It has anti-inflammatory properties that could be used to cure a range of inflammatory diseases. Irritable bowel disease, that is IBD, have a great clinical relevance in modern era because of its direct link with improper food habit and stressful lifestyle. In Ayurveda, the signs and symptoms of Grahani Roga in classics can be somehow related with IBD. The potential of arrowroot has not been fully utilized, mainly due to lack of knowledge on its technological and functional properties. Introduction. Tavakshiri or arrowroot is a herb belongs to Zingiberaceae family. Arrowroot is known to have several advantages, such as being a natural substitute to cure several diseases and inflammatory conditions. Arrowroot can be used by the form of gruel in case of IBD because it is easy to digest, easy available, nutritive, and is used as an agreeable, non-irritating diet. Case details. 27 years old female complains of loose stools associated with mucus discharge and bleeding per rectum since 1 year. Vomiting and urgency to pass stools immediately after taking food since 2 months. Associated with generalized weakness, loss of weight since 1 year, 20 kg reduced within 1 year, intermittent fever and burning sensation over chest region. History of present illness. Patient was healthy 2.5 years back, underwent hemorrhoidectomy 2 years back. After 1 month of surgery, patient had bleeding per rectum during defecation. Patient ignored it, thinking it was because of the surgical wound. Then gradually developed increased stool frequency. Consistency was mucus mixed watery stools. For this, she consulted a physician and underwent USG abdomen and pelvis. The condition got aggravated 2 months back. She had increased frequency of loose stools immediately after consuming food. Then she consulted a gastroenterologist and colonoscopy was advised, in which Crohn's disease was revealed. Objective: to find out the efficacy of arrowroot gruel for the management of irritable bowel disease. Personal history: weight 30.3 kg, height 152 cm, BMI 13.1 kg/m², appetite altered, bowel loose stools 15 to 20 times per day since 2 months, micturition regular, sleep disturbed. Systemic examination, CNS intact, conscious, well oriented to time, place, and person. CVS S1, S2 heard, respiratory, equal air entry to bilateral lung field, NPVS present. Per abdominal examination, soft, no organomegaly, tenderness present in right iliac and hypogastric region. Blood investigation, hemoglobin 8.8, total count 45,000, ESR 48, blood urea 15, serum creatinine 0.7, HIV and HbS negative. Methodology, Peya or gruel prepared as per classical reference, 1 part of arrowroot powder added with 14 parts of normal water and boiled in mandakini. Method of treatment given, arrowroot gruel 4 times a day for 7 days. Result, bowel frequency was reduced to 5 to 7 times from 15 to 20 times. Got symptomatic relief from mucus mixed watery consistency of stools. General condition of the patient was satisfactory. Discussion part, Tavakshiri or Tugakshira, curcuma angustifolia is a drug of choice to cure various ailments, especially Daha, Rektapitta, Pandu, Trishna, Kshaya, Ayuruji, and many other diseases. It is Madhura Kashaya Rasa, Lakhu, and has Shitavirya. It elevates Vata and Pitta dosha. It is Balya, Madhura, Brahmana, Shitala. Being Kashaya and Lakhu, Tavakshiri is used as Patyahara in Adisara condition. Arrowroot has high starch content and it helps in improving stool consistency and volume. In turn, this reduces the frequency of evacuation and helps to reduce dehydration because of its hema property. Arrowroot is extremely low in calories and is an effective natural remedy for diarrhea and irritable bowel diseases. Arrowroot supports healthy digestion because it is rich in starch that act as a mild laxative in regulating bowel movement and digestion. Peya was prescribed in the treatment of different clinical conditions with different drug combinations. Arrowroot gruel internally is more effective in treating IBD by reducing the frequency of evacuation. Conclusion, arrowroot gruel help in improve the stool free consistency, volume, and in reducing the frequency of stool evacuation. In turn, help for rehydration. Thus, it can be concluded that arrowroot gruel internally is more effective in treating IBD by reducing the frequency of evacuation and considered as it is one of the non-irritating diet. Thank you.
Thank you, doctor. Next, I would like to invite Dr. Sainath for the paper presentation. Dr. Sainath, are you there?
Yes, I'm here.
Hello, doctor.
Yes, I'm here. Just a minute.
Dr. Sainath, can you hear me?
Yes, sir.
Doctor, please start the session, doctor.
Just a minute. Is it visible?
Doctor, now is this screen is visible?
It is visible. Hello. Is it visible? Hello.
Hello, doctor. I will share for you, doctor. Your screen is not visible. I will share for you. Okay.
Just a minute. Just a minute. Just a minute.
Okay, okay, okay. You can share, doctor. You can share.
You will share, please.
Okay, 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 doctor. I will. Doctor, please start the session, doctor.
Hello.
Hello,
Myself,
doctor.
Sainath Bosle, from College of LKRD Ayurvedic College, Gadinglas, Kolhapur. My guide is Rajendra Dhari and HOD Dr. Vijay Rudrappa Ghor. Next. Hello. Hello.
Hello, doctor.
Hello.
Hello, doctor. Is the screen is visible, doctor?
uh, it's visible. Please share second slide, sir.
Doctor, it is in the second slide.
It's not the second slide. Hello.
Hello, doctor. Can you see the slides?
Yes, yes, yes. Study the effect of Chitrak Mool Churna Siddha Chakra in the management of Shushka Arsha with special reference to first and second degree non-bleeding hemorrhoids. Next slide. Just next. Hello. It's not next, sir.
1 minute, doctor.
I will read from my mobile.
Doctor, can you hear? Can you see the slide, doctor?
Yes, yes. The study of effect of Chitrak Mool Siddha Chakra in the management of Shushka Arsha with the special reference to first and second degree non-bleeding hemorrhoids. Objective of my study: to study of effect of Chitrak Mool Siddha Chakra in the management of Shushka Arsha with special reference to first and second degree non-bleeding hemorrhoids. Diagnosis of the patient was done on the following criteria: Kundu, bowel habits, pain during the defecation, pain after the defecation. Objective criteria: proctologic all parameters are given scale and they be measured and taken static consideration. My exclusive criteria: age between 18 to 6 years, of painful and pace first and degree non-bleeding hemorrhage. Any malignancy victim as immunocompressive patient like HIV, HBCG that is previously diagnosed. Uncontrolled diabetes mellitus of age group below 80 and below above the 70 age. A pregnant woman, bleeding third and fourth degree piles, Pitta Prakriti patient, fistula in ano. Presentation, preparations of my drug, the method of action. The Chitrak Mool Siddha Chakra. Hello. I am audible.
Audible, doctor. Please continue, doctor.
Preparation of the drug, the method of drug preparation. Chitrak Mool Siddha Chakra Nirmiti. Take a Mritika Patra, coat it in a layer with a Chitrak Mool Churna, wait until the totally dry. Then add 100 ml curd, which is made from cow milk, kept it aside overnight. Next day, early morning, add a 50 ml of water, shake it well, and it's called as Chitrak Mool Siddha Chakra. Methodology: subject will be diagnosed on the basis of Lakshana, Shushruta as per Ayurvedic literature. Invention of Chitrak Mool Chakra. Patients were advised to take 40 ml of Chitrak Mool Chakra twice a day for 15 days. Further follow-up was taken. Assessment will be done on the basis of subjective and objective parameters. Discussion. The etiology of Arsha according to Ayurveda interconnected with the Mandagni of the patient. The other few important causes of Arsha are sedentary lifestyle, standing, stressing during defecation, chronic constipation, diarrhea, diet controls, diet the consequence of big style, training for a long period, etc. The possible factor which lead to mandaging are the and the pitta prakriti, alcohol behavior, long time sitting position, stress may worse the symptom. Properties of Chitrakmul. The Chitrakmul of the roots of Chitrak are recommended in Ayurveda as Dipana and Pachana. As per Sharangar, according to the Acharya Charak, roots of Chitrak and white flowers, leads which promote the digestion, cure the piles, subside the properties of chakra. It is of two types based on the taste, that is Madhura Amla and Kashaya Anurasa. Laghu, Ruksha in nature, Ushna Virya and Madhura Vipaka, and it is properly digestive power. It is have a digestive power. Result by considering following factors in the patient before treatment and after treatment: Kandu, bowel habits, pain during defecation, pain after defecation, as well as after a proctoscopical examination. There was a significant change noted in the degree of all the factors. Conclusion. Thus, we can conclude that the Chitrakmul Siddhatakra effective in the management of first and second degree non-bleeding hemorrhoids, as well as it is cost effective for a patient and easily available for a general people. Thank you.
Thank you, doctor. Next, I would like to invite Dr. Bhagyashree Patel for the paper presentation. Dr. Bhagyashree Patel, are you there?
Yes, sir.
Okay, doctor, please share the screen, doctor. The screen is visible, doctor. Please start the session.
Okay. Myself, Dr. Bhagyashree Patil. I'm from second year PG Scholar, Department of Shalyatantra, STM Hassan. And my guide is Dr. Gopi Krishna BJ, Professor, Department of Shalyatantra. Today, I'm going to deal with the topic effect of Jalauka Charana in external thrombosed hemorrhoids, a case report. Introduction. Acharya Sushruta has considered Arshas as one among the Ashtamahagada. And according to Acharya Ashtangaradaya, he has told Arivat Pranan Shrunoti iti Arshas. Here, Arivat means Shatru. Arsha acts like a Shatru. Arsha can be correlated to different types of hemorrhoids and thrombosed pile masses. Among various hemorrhoids, external thrombosed piles requires an emergency line of management. Hence, I have taken this case. Hence, it is necessary to go for a safer method, and an attempt has been made to evaluate the efficacy of Jalauka Charana in a case of thrombosed pile mass. Next is patient information and description. In the present study, I have taken a case of male aged 40 years who is a shopkeeper by an occupation, who hails from Hole Narsipura, Hassan. And his chief complaints are he had the following complaints, which are severe pain and burning sensation in anal region, and big mass coming out from the anal verge, and difficulty in passing stool, and constipation from last 10 days. He had not taken any treatment previously, and he directly approached our hospital for further management. Past history, he has no relevant history regarding Arshas, and on his general examination, his vitals are stable. On local examination, on inspection, perianal area was dry, and the perianal skin, external thrombosed hemorrhoids present at 11 o'clock position, and edema in perianal skin was present, and there was no abscess or discharge seen. No external opening was seen, and no sentinel tag was seen. From this, we can exclude fissure and fistula. And on palpation, there was tenderness, and on distal rectal examination, sphincter tonicity was normal. There was no thickening of wall of anal canal, and rectal mucosa. On proctoscopic examination, rectal mucosa was smooth, regular, and mobile. There was no fecolith present. Diagnosis: it is a thrombosed external hemorrhoids at 11 o'clock, and which can be taken as rakta ashes with sanchita dushta rudra, because patient was having bleeding per rectum. And therapeutic intervention in present study was Abhayarishta was given 15 ml BD with lukewarm water after food, and Jalaukacharna was done every alternate days for 3 sittings. Purvakarma for Jalaukacharna was Sambara Sangraha, activation or purification of Jalauka, and part preparation of the patient. Sambara Sangraha includes Jalauka, bowls 3 to 4 in number, water, gloves, and Haridra powder. In activation or purification of Jalauka includes Jalaukas were kept in Haridra water for 20 minutes, then transferred to fresh water, which are ready for the use, which are activated. Next is Pradhana Karma. Patient was advised to lie down in lithotomy position, and anterior sucker of the Jalauka was placed at the site of application where the Jalauka was expected to be fixed. Then leeches were covered with wet gauze pieces to keep it moist. Procedure was carried out till the leeches got detached on their own. Pachat Karma includes 2 factors, that is emesis of the Jalauka and care of the patient. Care of the patient includes the site of the application was cleaned with normal saline, and sprinkling of Haridra powder was done, followed by application of tea bandage to reduce the further bleeding. And patient was advised to do sitz bath with Triphala Churna every 6th hourly. After treatment, observation includes before Jalauka Charana, patient was having more pain, Vibhanda, Gudadaha, and Shotha. Vedana was given as 9, Vibhanda was 9, and Gudadaha was 7, Shotha was 10. And after Jalauka Charana, Vedana reduced to 2, and there was no Vibhanda, and Gudadaha was 2, and Shotha was 3. These are the pictures, which includes before Jalauka Charana, there was thrombosed big pile mass we can see, and after one sitting, there is reduced in size, and after third sitting, there is almost complete reduction in the size. Conclusion: follow-up patient was called for follow-up after every week in OPD. After a week, then after 7 days on examination, it was observed that hemorrhoids was shrunken in size. Conclusion: Jalauka can be done at OPD level without any anesthetics, antibiotics, antiseptics, and analgesic drugs. And Jalauka has got minimum to no complications. In the present study, the success of Jalauka is pragmatic in emergency management of pain, reducing in size of thrombosed hemorrhoids, and which improves the quality of life. Thank you.
Thank you, Dr. Bhagishri Patel.
Thank you, Doctor. Next, I invite Dr. Jissi Vijay. I invite Dr. Jissi for the paper presentation.
Yes, ma'am. Yes, ma'am. Can I audible?
Audible, Doctor. Please share the screen, Doctor.
Yes, yes.
Your screen is visible, Doctor. Please start the session.
Yes, sir. Yes, sir. Good evening, everyone. Myself, Dr. GCVS, final year Shalya PG. My grade name is Dr. Mahesh Kumar ES, HOD and Associate Professor, Department of Shalyatantra. And today I am presenting the topic Management of Shobhayukta Charmakila Arshas. It's a Sentinel 5, a case study. And need of selecting topic is Jaloga Ujjana and Sharasutra are parasurgical procedures as it can be done OPD and IPD basis with a less complication and without any surgical intervention. And introduction, Jalogavajana is an Anishastra, a type of Rektamokshana karma applied over Shobhayukta Charmakila ashes for reducing the inflammation, and Sharasutra is the medicated thread prepared from Snuhi, Apamargakshara and Haridra. And Charmakila ashes is a skin tag also associated with the chronic fishery nano. And Jalogavajana and Sharasutra are good Anishastra to surgery as it is less risky and can be performed easily. It is a safe ambulatory OPD procedure. Case presentation. A female patient named SS, aged 56 years, complains of mass per rectum associated with a difficulty in sitting and severe pain since 1 year. Complaints of bleeding associated with a burning sensation during defecation since 1 week. Since she is a non-case of type 2 DM and hypertension under oral medication since 1 year, and symptoms increased since 1 week. Patient feeling difficulty in sitting position and severe pain. For that, she came to our hospital for further management. And she underwent rectal examination. After rectal examination, diagnosed as chronic fissure with inflamed sentinel tag at 6 and 10 o'clock position. 10 o'clock position. First, we treated her as in the patient with Jaloga for pain management and Matravasti. Along with that, we gave Matravasti Sisbat with Tribalajurna. And after 1 week of IPD treatment, we discharged her, and on next visit in our OPD, we treated sentinel tag after examining her pain reduced and fissure healed. And the other management what we given are Jalogavajana for inflamed sentinel tag for 5 days, and then Matravasti with the Mahanarayana Taila and Sisbat with Tribalajurna, then orally Bodabhadra Rasa and Nimbadi Gugulu and Sharasutra application. These are the pictures. Before treatment, when she came, that time inflamed sentinel was there, sentinel tag was there, 6 and 10 o'clock position. And as Charmakila ashes, we know it is a Charmabi Guhyasya Charmani. So it will cause the pricking sensation like key level. So here inflamed. So Pitta dosha is increased. In Charmakila ashes, Tridosha is vitiated. Due to Vada, Nistoda will be there, and due to Sleshma, there will be Grendi, Savarnatum and Grenditum will be there, and due to Pitta Shonida, it will become Rauksha, Krishnada, and Sleshnada will be there. So, first we reduce the Pitta dosha. For that, we gave Jalogavajana for 5 days. After that, on first sitting, OPD base, we gave Sharasutra, which is prepared from Apamargakshara. And like this, second sitting, third sitting, fourth sitting, and fifth sitting, almost it cut through. And observation and result. After Jalogavajana, the inflammation become reduced, and then sentinel pile got cut off within 4 weeks according to the size of the sentinel tag, and patient got symptomatic relief from the complaints. And discussion. The Charmakila ashes, which is occurs due to Prakrutavada, along with here Prakrutavada is Banavayu, along with Sleshma, and it causes the formation of skin tag structure, spot-like structure, and sentinel pile always associated with the chronic fissure in ano. It is a goading of chronic fissure in ano. So chronic fissure in ano is a deep ulcer which is seen at midline, anteriorly and posteriorly. And we gave Jalogavajana for Pitta dosha vitiation, and Sharasutra, we gave here 21 coating Sharasutra with 11 coating of Snuhikshira, and 7 coating of Avamargakshara, and 3 coating of Haridra. Here we know Kshara have Sharanata, and Chedana, Tridoshana property. Because of that, we use here. And conclusion, Jalogavajana, which helps to reducing inflammation, and Sharasutra for excision without complication. Thank you.
Doctor, hello.
Yes,
Doctor, Doctor, only your external this Jalogavajana and no internal medications you are given for the patient?
Yes, ma'am. Yes. Nimbadi Gugulu and Bodabhadra Rasa. As Nimbadi Gugulu, Kabavada vitiation it will reduce, and as Pittahara we gave Bodabhadra Rasa.
No laxative, nothing is given for the patient?
No, ma'am. As in Nimbadi Gugulu, here Tribala is there.
Okay, the patient no, only the Nimbadi Gugulu and this Boladi. What is Boladi Gugulu? Boladi Varpadi. What is that?
Bodabhadra Rasa.
Okay, only these 2 medicines you have managed. Only how many
Yes.
observation after first Jalogavajana, no? The second sleeping was after
Yes, ma'am.
No. How many days of follow-up you had given for each sitting? No, 5 sittings you had told. No, so in between,
Yes,
how
ma'am.
many days of
Around
gap?
1.5 months it took. Around 1.5 months it took, ma'am. First 5 days we gave Jaloka Ujarna. After 1 week we started our Sharasutra application. So each after 7 days, next sitting we did. So around 1.5 months it took.
Okay, good. Thank you.
Okay, thank you.
Thank you, Dr. Ashwati. And thank you, Dr. Jisi. Next, I would like to invite Dr. Vishwanatha Gupta for the paper presentation. Sorry, there is a change. Dr. Adi Vishwanatha Gupta.
Audible, doctor.
Doctor, please share the screen. Hello, Dr. Adi Vishwanatha.
Yes, ma'am. 1 second.
Doctor, please share the screen.
Is it visible, ma'am?
Yes, doctor.
Is the screen visible, ma'am?
Visible,
Yes,
doctor.
doctor.
Please
Please.
continue, doctor. Please start the session.
Namaste to all present here. My topic is symptomatic management of Vatakandaka by Agni Karma, a case study. My name is Dr. Adi Vishwanath Gupta PG, second year PG scholar from the Department of Shalya Tantra, CM College of Ayurveda, Hassan. My guide's name is Dr. Gopi Krishna BJ, Professor, Department of Shalya Tantra, CM College of Ayurveda, Hassan. The contents of this presentation include need for study, introduction, materials, and methods of observation, results, discussion, and conclusion. Need for the study. People older than 40 years, overweight, walking gait abnormality, especially females, are prone for calcaneus birth. Out of 200 heel pain, 180 are due to calcaneus birth. People have severe pain which need long-term medication, leading to economic burden and decreased quality of life. Pharmacological managements like NSAID, cortisone injection, botulinum toxin, and surgical approaches like plantar fasciotomy are not having promising long-term results. To find an alternative for calcaneal spur, which we equated as Vatakandaka to Ayurveda. Introduction. Calcaneal spur is a bony projection projecting forward from undersurface of calcaneal tuberosity. It is a non-fatal but severely painful condition affecting people walking on irregular or uneven ground, structural deformity of foot, improper footwear selection, excessive strain on heels, etc. It is correlated with Vatakandaka in Ayurveda. Sushruta Nidhana states that Nyaste tu Vishmam Pade Guja Puriya Samirana Vatakandaka Ityesha Vigneya Kudakashrata. Sushruta mentions that the disease Vatakandaka is caused by vitiated Vata dosha due to constant standing and walking on uneven surface resulting into pain in foot. It is characterized by Shula Shota in Kudaka, which is a Snayu Asti Sandhi Ashrita. The case goes like this. Name of the patient, age of the patient was 50 years. It was a male patient. Occupation coolie from Holenarsipura, Hassan. Chief complaints include pain on bilateral heels from last 6 months, morning stiffness on bilateral soles, History of present illness. Gradually developed pain on bilateral soles, especially on bilateral heels. Pain aggravated on working and relieved on rest. Pain was severe enough to hamper the normal gait of patients. Occasional limping gait was also present. Moderate intensity of stiffness was present on bilateral soles at early morning. On examination, all the general examinations, including pallor, itching, lymphadenopathy, cyanosis, clubbing, edema, dehydration, were absent. Chest, per abdomen examination, cardiovascular system examination, respiratory system examination, no abnormalities were detected. Local examination showed that on inspection, multiple cracks were found on bilateral heels. Palpitation, mild to moderate tenderness on bilateral heels, no local rise in temperature, but there was limping gait. This is the X-ray of foot. Diagnosis, we diagnosed it as calcaneal spur. It can be correlated with Vatakandaka in Ayurveda. Samprapti is as follows: walking on irregular or uneven ground, excessive strain in heels causes exhaustion. Vitiation and aggravation of Vata located in Gilpa region. Pain produces pain in Pada, which we can correlate to Vata. Treatment which we followed was Agnikarma by Loha Salati, application of Vatakandaka. Before treatment and after treatment. Before the treatment, pain and bilateral heels.
Hello, Dr. Adi Vishwanatha.
Yes. Can you hear me?
Your voice is too low. Please raise your volume.
Okay. Can you hear me now?
Yes,
Can you hear
doctor.
me? Okay. Okay. Before and after treatment comparison. Before the treatment, the pain on bilateral heels on visual analog scale was 8. There was limping gait and moderate morning stiffness on bilateral sole. After the treatment, the pain on bilateral heel on visual analog scale was 3. Normal gait, mild morning stiffness on bilateral soles. Discussion. Calcaneal spur, we can correlate to Vatakandaka. Symptoms of calcaneal spur are well correlated with Vatakandaka. Agnikarma in Vatakandaka is mentioned by Sushruta in Dhatugata Vata Vyadhi Chikitsa, Bhava Prakasha in Vata Vyadhi Adhikara, Ashtanga Hridaya Vata Vyadhi Nidana. Agnikarma is indicated in vitiation of Vata and Kapha doshas. Due to Ushna, Sukshma, Tikshna and Ashukari property of Agni, it specifies Vata and Kapha doshas. Panchaloha Shalaka help to maintain the constant temperature. Once heated, it will produce 20 to 30 Samyak Dagda Vrana. Shatadauta Grita has Snigdha, Shita Guna and Shita Virya and helps in Ropana. Conclusion. Calcaneal spur, which is very painful condition, was symptomatically relieved through Agnikarma, which is described in Ayurveda. Modern science also does not have promising long-term results on this regard. Ayurveda can be a boon for this condition. Example, in this case, the patient was significantly benefited by Agnikarma. Thank you.
Thank you, doctor. Next, I invite Dr. Poonam R. Gupta. Dr. Poonam, are you there? So next, I invite Dr. Shubham Pokarna. I invite Dr. Shubham Pokarna.
Hello, Dr. Shubham, are you there?
Hello.
Hello.
Hello. Am I audible?
Audible, doctor.
Can
Doctor,
I share
please
my
share the
screen?
screen. Please share the screen, doctor.
Yes, I'm going to share the screen. Just a
Okay,
minute.
doctor. Please share. Your screen is visible, doctor. Please start the session.
So, starting with my name is Shubham Prokharna, Kriyashali Department from GSC Usmanabad, second year student. My topic for paper presentation is management of Grihani through Ayurveda, a case study. Now, we all know the importance of the Dehagni, that is, it causes Ayu, Bala, Varna, Swatsa, Utsaha, and Upchaya of the Prabha in the persons. Also, Oja, Tejo, Agneya are all the in correlation with the Dehagni. We all know if the Agni is Shanta, then we it called as death, person is dead, we consider as Yukta Agni Chirajivitam, and if the Agni got Vikruta, if the person is, we call as Rogi. There are 4 different types of the Agni according to the Acharya Charak, as Vishamagni causes Vishamapachan of the Dhatu, Tikshana Agni causes Vishoshan of the Dhatu, of which Yukta Agni causes Dhatu Samya and Pachana, Samyak Pachana, and Durbal Agni, that is Mandagni, causes Vidaha of the Anna. Now, the Samanya Hetu, that is etiological factor for the Grihani according to the Acharya Charak. These are Abhojanata, Ajirnata, Atibhojanata, Vishamashanata, Asatmya, Guru Shita, Atiruksha, Sandushta Bhojanata, Vireka Vamana Sneha, Vibhrama, and Vyadhi Karshana, Deshakala Rutu, Vaishamya, and Veg Vidharana. All these are the etiological factors for the Grihani Roga according to the Acharya Charak. Madhav Nidana has tell the typical factor, consecutive factor for the Grihani is Atisari Nivritta Pi Manda Agni Ahitashan. That is, after the Nivritti of the Atisar, person start taking Mithya Ahar Vihara. Then there is a Dushan of the Agni and causes the Grihani disorder. Here's the short summary how the Grihani occurs. That is, due to the Mandagni, in case of Mandagni, person take the Ahitkar Ahar Vihara for long days. Then it causes Grihani dosha, due to which probable digestion of the food is not taken place, which causes Vidagdha Avastha, which again result into the Shukta Pak. And then there is Vikruti of the Grihani and causes Grihani disorder, so which the proper function of the Grihani, that is Annam Gruhati Pachati Vivachati Muchati, is not happening. So the Pururupa of the Grihani according to the Acharya Charak is Trushna, Alasya, Balakshaya, Vidaha of the Anna, Chirata Paka, and Gavrauta. According to the Ashtangrudaya, the Ashtangrudaya is still the typical Pururupa of the Grihani is a Karna Shweda, and also the other consecutive other Pururupas like Sadhana, Chirata Pachana, Amlata, Vaktravirasya, Aruchi, Truta, Klama, all these are the Pururupa in the patient of the Grihani. Now the Rupa according to the Acharya Charak is most important, that Atisrushta Vibadda va Drava Mala Pravrutti, that is Atisrushta in the case when the Agni is Pradipta, a slight Pradipta, and it causes Atisrushta Mala Pravrutti. Vibandha in the case of more Mandagni, there is a Vibandha of the feces. Also, the other typical characteristic of the Grihani is Shuna Pada Karaha. Other are the Trishna, Arojak, Vairasya, Praseka, Tamakanvita is also the important Rupa for the Grihani disorder, Loha and Amlagandhi Udgara. Now, according to the Madhav Nidana, it's Muhurbadha and Muhurdrava is the typical cardinal feature of the Grihani according to the Acharya Madhav Nidan. Also, now I'm going to present a case of Grihani which we have in our Kai Chikitsa department. So the person was a male, 35-year, married, and he is teacher by profession. He comes in our Chikitsa, Kai Chikitsa OPD with complaining of Aruchi, Amla Udgar, Kochita Drava and Kochita Baddhamala Pravrutti. मल प्रवृत्ति पश्चात उदरशूल, शिरशूल, शिरोगौरव, अनिद्रतता, and sometimes he also complained of insomnia, that is insomnia, mutradaha, praseka, angagaurav, penis, and mukha and tvokavaivarna with kandu. Now, the detailed history of the patient was a 35-year male patient come in our Kachiketsa OPD at GH Usmanabad, complaining of Anidrata Alpanidrata since 6 months, Shirogaurav, Angagaurav since 9 months, Kochita Drava and Kochita Baddhamal Pravritti and Bhojan Pachat Udarshul since 2 years, Aruchi Amla Udgar and Prasek since 3 years. So, for the above complaint, patient was admitted in our Kaichikitsa male ward for the further treatment and management. Now, on the detailed examination, we found the hetu like abhojan, ajirnashan, vishamashan, asatmya bhojana, deshakala, rutuvaishamya, and veg vidharana in the patient. After we go for the detailed history and past history, so we found the patient has previously done the vitamin B12 report, and he has vitamin B12 deficiency induced neuropathy, and also the bleeding through the Guda Marga. Now, on the family history of the patient was his mother has the history of hemorrhoid, his father has the history of hypertension and taking the medicine, but his sibling does not have any history. In also, the family history does not contain asthma and type 2 DM. On Ashtavidha Parikshana, we found Nadi 74 per minute. Small Pravritti he has 4 to 5 times in the morning time. Mutra also Samyak, and he has to go for the maturation for the 8 to 10 times. Nidra is Alpanidrata, Anidrata, Sparsha is Samashitoshna, Shabda Spashta, Jivva, Sam, Akruti Madhyam Stul. On examination, BP was 130 by 90 mm of Hg. On systemic examination, his respiratory system was quite normal. Cardiovascular system is also normal. And CNS, he is conscious and well oriented, having orientation of time, place, and person. On per abdo examination, on inspection, we don't get any special condition. On palpation, there is tenderness over right iliac fossa and in the umbilical region and right lumbar region. On percussion, we feel dull note over the left iliac region, and on auscultation, the peristaltic sounds are quite normal. Now, the moving towards the medicinal part, the best treatment for the grahani is Dipana Pachana and Viraj after Dipana Pachana, removal of the excess of armor by the nearest root. So for the Pachana, we give the Ampachakvati, that is 1 tablet in morning, evening, and night, and Hingvashtak Churna 2 gram in morning and night before the meal with the Gogrut. For the Virechana, we give Aragvad and Kapilavati as 2 tablets in night with lukewarm water. The most important Pathadio, which is given by the Acharya Charaka, we prescribe the patient with the composition like Haritki 1 gram, Shunti 500 milligram, Pipali 500 milligram, Sendo 125 milligram in morning and night after the meal with lukewarm water. Jatamansi Fan 20 milligram in night. Also syrup prasham 10 ml before to bed. Also we give to the patient Nasa Dhupan with Vacha 1 gram, Pipali 1 gram, Haridra 1 gram, and Bhimseni Karpur 0.5 milligram in morning. And for local application, we give Shunti Churna, Daru Haridra Churna, and Kumari Kalka in morning and night. So the most important part for after the treatment is Patya Patya in the patient. So we advise him to take the Agnivardha Kannapana like Trikatu Siddha Yavagu. We explain the procedure of Yavagu to him also. Panchakul Siddha Yavagu. The Takra Prayoga, which is the most important Patya in the Grahani disease. Grudha Prayoga. For the Vihar, we advise him Anulom Vilom Pranayam. This is the detailed description before and after treatment chart. So thank you.
Thank you, doctor.
Thank you, doctor. So next I invite Dr. Prativa. So Dr. Prativa.
Yes, ma'am. Am I audible?
Yes, doctor.
Hello, ma'am.
Yes, doctor, your screen is sharing. Yeah, it's visible now.
Okay. Shall I start?
Yes, please.
Good evening, everyone. I am Dr. Pratibha Talukdar. I am second year PG scholar. Today my topic is effect of Marmani Bhatti Alepa external application with Chincharasa in the pain management of Abhighataja Apabahuka, a case study. My guide is Dr. Prasanna Narasimha Rao, Principal and Professor of SDM College Hassan. I am from Department of Shalyatantra. Introduction. Acharya Sushruta in Sushruta Samhita considers Apabahuka as a Vataja Vikara. It is usually affects the shoulder joint, which is Amsa Sandhi mentioned in the Ayurveda. Amsa Shosha, which is wasting of shoulder, is the preliminary stage of the disease, where the loss of Shleshmaka Kapha from Amsa Sandhi occurs. Apabahuka, due to injury, which is considered as Badhya Hetu, which is coming from outside the body, is called Abhighataja Apabahuka. Brachial, now with modern we can correlate it, like brachial plexus injury is the commonest type of injury which mostly occurs from fall over the shoulder region in the road traffic accident in India and all over the world. Patient will have severe pain with difficulty in movement of the affected upper limb. Hence, I am presenting this topic, and it is necessary to go for the method. An attempt has been put forward to evaluate the efficacy. And basic information of the patient is a male patient, 55 years old, is a resident of Hosur. Occupationally, he is a farmer. Built his skin. He got admitted on 11/11/21 to our hospital. He's not having diabetes or hypertension or any other previous medication he was taking. He was not having any familial history. So patient came with chief complaint, pain and stiffness and numbness from left shoulder joint to left elbow joint since last 4 months, loss of movement and reduced muscle power in the left upper limb since last 4 months, symptom aggravated after forceful movement. History of the presenting complaint. Patient was apparently healthy 4 months back. He met with a road accident 4 months ago, fell down on his left arm from a running ride, and he got injured. For this, he consulted a local physician, and external injuries got healed with mild reduction of pain, that is 10%. After 3 days, that pain aggravated with movement. According to visual analog score, as the patient described, his pain rated as 8. Now, what we gave the treatment? First, tender lesion over the left shoulder joint we identified. Then we took Marmani Bhatti. We made it up in powder. Then we mixed hot water and made it a thick paste. With that, we added Chincha, Swarasa and mixed with it. And we made a thick paste of it and applied twice a day for 30 minutes for continuous 1 week. We made keep the paste until it got dry. Then we wash it off with hot water. Marma therapy was done alternatively there along with it, and internally we gave Lakshadi Gugula 2 tablets BD after food, and Dashamula Kvata we gave, and for local application at night, and for Abhyanga we gave Murivenna oil. This is the Marmani Bhatti, and from our hospital we took, and Chincha Sarasa we made with mixed with it. Now the result, after 1 week, pain reduced 80%. His agony and discomfort level also reduced. There was significant reduction in pain and stiffness. According to visual analog scale, pain reduced to 2, which was during admission was 8, then it reduced to 2. Reduction reduced tenderness and increased range of motion of the left upper limb axis. He was relieved and satisfied with the treatment. So we considered before treatment and after treatment. So first his complaint was heaviness over the left shoulder, which heaviness reduced 90%. Abduction when he got admitted was 30 degree only, and after 1 week it was more than 90 degree. Stiffness over the left shoulder, which reduced 80%. Pain on analog scale was 8 and pain reduced to 2. Difficulty in movement, and that reduced 60%. to discussion. Symptoms of brachiospheric injury, and we can correlate with the upper bahuka. Marmani Bhatti, which is mentioned in Sahasra Yoga, Bhatti Kalpana, which acts as a Shulahara, Tridoshagna, Shofahara, and Daha Prashamana Kara effect. Adding Chincha Sarasa, it gives Bhatahara and Shula Prashamana effect. External application of Marmani Bhatti Alepa is very simple, non-invasive, and easy to apply, and we can do it over OPD waist level also, which reduces the Abhigataja Apavahuka Shula. Thank you.
Thank you, doctor. So next I invite Dr. Ravindra Ramsingh Thakur. I invite
Hello.
Dr. Ravindra.
Hello. Hello,
Hello,
madam.
doctor. Yeah, you are audible, doctor.
I am sharing the PPT. Please give me permission.
Dr. Protiva, please stop the screen sharing. Dr. Protiva, please stop your screen sharing.
Hello.
Yes, doctor, your screen is sharing now.
Is it visible, madam?
Well, doctor, please start.
Yes. Myself, Dr. Ravindra Ramsingh Thakur, final year Samhita student from Yashwant Ayurvedic College, Postgraduate Research Institute, Training Center, Kodoli, Panala, Kolhapur, Maharashtra. My guide is Dr. Harshal S. Sabre. He is Associate Professor in Samhita Department, and HOD, Dr. S.G. Kulkarni sir. He is a honorable HOD from Maulik Samhita Siddhant. My today's topic is पहिली slide. First, Bija Chatushta, speciality of Sushruta Samhita. Next. Bija Chatushta is a special, unique contribution of Sushruta Samhita. Whole Sushruta Samhita has been elaborated on the basis of the principle as Sushruta Samhita is Shalya Pradhan Shastra. Bija Chatushta includes Purusha, Vyadhi, Aushad, Kriya Kal. Ayurveda accepts Loka Purusha Samya Siddhanta and Panchamahabhut Siddhanta. Thus, Purusha is considered to be the combination of Panchamahabhut and Atma. This Karma Purush provides Adhishtan and Ashray for Vyadhi and Chikitsa. The Rog, Dukha, Vedana includes all the types of Sharirik, Mansik, and Agantuchu Vedana. Dukha Nivrutti can be achieved by administering different principles of Kriya or Chikitsa by using different medicine and other measures. In Bija Chatushta, Kriya refers to the Swasthanuvartan, Chikitsa, Antarashray, Snehadi Karma, Bahirashray, that is Shastradi Karma. Kala refers to the administration of procedure at proper time, like Snehapan in Prabhat Kala, Swedan in Jirnana Kala, Vamana in Purvanna, Virechan in Prabhat Kal, and Astapana in Madhyana Kal, and Anuvasan in Sandhya Kal, Pradosh Kal after food. Kal also refers to the Avastik Kal, like Langhana in Sama Avastha of Jwara, and Gritapan in Jirna Avastha. Introduction. Samyak Yoga of Desh, Kal, Praman, Satma, Asatma, Pathya, Apatya are very essential in the success of any treatment. Kal plays an important role right from the drug collection till the administration of the medicine. Sankhya, the philosopher, mentioned Kal as Ayut Siddhanta, Siddha, Nimitta, Karana, and Ayurveda with the different terms as Dush Prakriya. Kal implies the Dina, Rutu, Rogi, Aushadha, Jirana, Linga. Selection of the proper medicine at proper time is very necessary to attain the expert outcome in the treatment. Bija Chatushtay is the special unique contribution of Shushruta Samhita. The wholesome Shushruta Samhita has been elaborated on the basis of principle. Thus, the seed of the medicine has been propounded in nutshell as it is elaborated in 120 chapter. As the seed put in the earth grows with root, stem, branches, leaves, and expand further, the seed of the medicine likewise extending in the section of Sutrasthana, Nidanasthana, Sharirasthana, Chikitsasthana, and Kalpasthana, etc., gives the fruit of health. Bija Chatushtay include Purusha Vyadhi, Aushadha Kriya Kal. Whole Sushruta Samhita has been elaborated on the base of Bija Chatushtay methodology. Bija Chikitsitasai Tat Samasena Prakirtitam Savishamadhyashaya Etamasya Vyakya Bhavishyati. Shushruta Sutrasthan, Chapter 1, 29th Shloka. Review of literature by Purusha are meant the originating material and 5 Mahabhuta and also Anga Pratyanga laya of same like Tvak, Mans, Rakta, Sira, Kandara, etc. by Vyadhi are taken. All the disorder caused by the imbalance of Vata, Pitta, Kapha, Rakta by Aushadha are meant the Dravya, Rasa, Guna, Virya, Vipak by Kriya, all the applications, functions, etc. and all the operations, exercise, etc. are mentioned. Kal includes right time for all the actions. Though there are 5 entities been told here, essentially they are only 4, as there is no Kal other than action nor action other than remedy. The time pertaining to action and action itself becomes the 4th one. Purusha is a receptacle of any particular disease, and that which proves a source of pain, discomfort to him is denominated as the disease. There are 4 different types of the disease, such as Agantu, Shararik, Manasik, and Swabhavik. The disease due to an exogenous blow of hurt is called as Agantu. Disease due to the irregular food or drink or incidental to deranged state of Sharirik Dhatu acting Eka Doshaj Samsarga or Sannipataj called Sharirik Vyadhi. Excessive anger, grief, fear, joy, dependency, envy, misery, and pride, greed, lust, desire, malice, etc. are included within the category of mental distempers, whereas the hunger, thirst, discrepitude, imbecility, death, sleep, etc. are called the natural swabhavaj, degenerating of the body. The mind and the body are seat of Vyadhi, and the disease are restricted to either of them or affect both of them in unison. Vyadhi disease have originating base in body and mind. Some are psychic, some are somatic, while others are psychosomatic like fever, insanity, etc. Each are known as Deha, Manas, Manodahik. Charak also mentioned body and mind as substratum of the disease, and Samshodhana and Samshamana are come under the Aushadha. Ahar is Anna and Achar is Vihar. Thus, application of the Aushadha is proper manner successfully prevents and alleviates the disease. Aushadha, Samshodhana is that purifies well. It is of 2 types, external and internal. The former such as sharp instrument application of Kshar, Agni, Karma, etc. while Samshodhana are Vaman, Virechan, Basti, Raktamokshan. Charak consider Nasya and Shiro Virechan as one among the Samshodhana. The substance which is specified the vitiated dosha without eliminating it is known as Samshamana, and Samshamana is that which does not eliminate dosh or does aggravate. The balanced one is specifies the aggravated one is known as Samshamana. This is of 2 types of external and internal. The Bahya Chikitsa includes Abhyanga, Udvartan, Snana, Udgarshan, Lepa, Avagaha, Mardana, Shirodhara, Murdini Tel, etc. Internal treatment includes Rasayan, Vajikaran, Langan, Bruhan, Langan, Santarpan, Apatarpan, etc. Anna or food substances are of 4 types: Peya, Leha, Khadya, and Bhaksha. Agni is of 3 types. There are Dosha Prashamana, Vyadhi Prashamana, and Swastarutta Karaha. Some of those Samshodhana by dint of specifying those include diet, it's mentioned separately, is intended to indicate important role of diet in Samshodhana, etc., or healthy person being no context of specification of dosha or disease. The diet is mentioned separately. Achar consists of activities relating to body, speech, and mind. Kriya Kal, the word Kriya means action and Kala means time. Therefore, the literal meaning of the word Kriya Kal is the treatment time. Kriya Kal describes the mode of stages of developing disease. It refers to the proper diagnosis of the stages of the disease and adopting preventive and curative measures of the Aushadha, Ahar, and Achar, drugs, diet, activities. If we ignore our health, the disease process samprapti sets in, and this means the instead of 3 stages, 6 different stages are produced, and a well manifested disease known as roga begins. Kriya Kal means the time of treatment, interceptions in the process of disease manifestation. These 6 stages mentioned by the Acharya Shushruta gives an idea regarding the state of disease in the body, and it guides us when to intervene and where to intervene. Conclusion: Bija Chatushtay or Chikitsa Chatushtay. It is also called a Chikitsa Chatushtay. Chikitsa Chatushtay is an important, fundamental, unique concept methodology adopted by Acharya Shushruta. This concept is based and forms to make the framework of the Shushruta Samhita, which is scattered throughout this Samhita, utilizing the Bija Chatushtay concept while diagnosing, planning, treatment, procedure, administration of the proper medicine in proper time in the disease condition will give a success in treatment of Bija Chatushtay comprises 2 words, Bija and Chatushtay. Bija means the seed and the Chatushtay means 4 factors. Following these 4 factors are very necessary in the treatment of the disease. So the Bija Chatushtay also called as Chikitsa Chatushtay, that is Purusha, Vyadhi, Bheshaj, and Kriya Kala. So here are some references. Thank you, ma'am. It's over to you.
Thank you, Doctor. So next I invite Dr. Deepak NP for the paper presentation. I invite Dr. Deepak.
Hello, madam.
Hello, doctor. Please share the screen.
Hello, madam. Can you hear me, ma'am?
Yes, doctor, you are audible.
Hello, madam. It's visible, madam.
Yes, it's visible, doctor. Please start.
Okay, madam. Thank you. Myself, Dr. Deepak NP, second year PG scholar, guided under Dr. Lohit BA, Associate Professor and HOD, Department of Panchakarma, SDM Hassan. Today I am discussing the topic Ubanaha Sweda with a novel combination of ingredients in Janu Santigada Vada. Need of selecting topic. Janu Ubanaha is one of the most common treatment advocated in the management of Janu Santigada Vada. Drugs are used in the studies are easily available and many research studies are being carried out. Middle and lower socio-economical status people can be affordable the treatment charges. Introduction. Swedana Karma is one of the Purva Karma and Ubanaha belongs to one such type of Swedana Karma. Swedana Ubanaha means Uba means near, Naha means Bandhana or to tie. Procedure whereby warm medicinal herbal paste is applied locally to the affected part of the body. Duration of Ubanaha is longer, that is 12 hours. Contact time with skin, more retention of heat and drug absorption is more in Ubanaha Sweda than compared with the other Swedana therapies. Drugs used in the studies are Ardraga, Palandu, Lashuna, Haridra, Samudra Lavana, Chincha, Goduma, Tilataila. And material required for the study, Ardraga, that is Kadurasa, Tikshna, Ruksha, Guru Guna, Ushna Virya, Madhura Vibhaga, and Kafahara, Karma, Pajana, Vrishya, Dibana, Shulahara, Shofahara. And Palando, Madhura, Kadurasa, Snigdha, Guru Guna, Ushna Virya, Madhura Vibhaga, Vadahara, and Karma, that is Balya, Vrishya, Rujigara, Dibana, and Lashuna, Amlavarjita, Pancharasa, Tikshna, Snigdha, Guru, Sara, Guna, Ushna Virya, Kadu Vibhaga, Vada, and Kafahara. Karma, Brahmana, Shopahara, Shulahara, and
Hello,
Rasa.
doctor.
Hello?
Hello, doctor. Screen is not moving, doctor.
Hello, sir. Now it's...
Now it is in the first slide.
Okay.
Okay, doctor. Now moving, doctor.
Now it's okay, sir.
Okay, doctor. Okay.
Okay. Lashuna, that is Amla Varjita Pancharasa, and Guna, Tikshna, Snigdha, Guru, and Sara, Ushna Virya, Kadu Vibhaga, Vada and Kafahara, Brahmana, Karma, Brahmana, Shofahara, Shulahara, Rasayana, and Vrishya. And Goduma, that is Madhura Rasa, Guru Snigdha Guna, Shida Virya, Madhura Vibhaga, Vada Pitta Shamaga, and main Karma, that is Brahmana. Samudra Lavana, Rasa Lavana, Isha Snigdha Guna, Na Adi, Ushna Virya, Madhura Vibhaga, and Vada Kafa Shamaga, and Karma Shulagna. And drug and material for one knee joint for that application. Ardraga, that is 25 gram, Palando 25 gram, Lashuna 25 gram, and Haridra 25 gram, Samudra Lavana 15 gram, Chincha, that is 50 gram, mix well in 500 ml of water reduced to 250 ml, and Tilataila, that is 30 ml lukewarm, and Goduma 120 gram, gas stove, kadai, spatula, that is 1, and banana leaf, which is 35 centimeter to 45 centimeter 1, cotton roll bandage 100 centimeter into 1.5 meter, Eranta Patra 3, and a rolling pin 1. Method, that is Purva Karma, Goduma, Haridra, and Samudra Lavana all together were taken in the pan of heating. Heating was continued till the mixture become slightly warm. When make fine paste of fresh Lashuna, Pandu, and Ardraga with the help of mixer grinder and add into the pan. This mixture was mixed well till both the powdered drugs and pasted drugs bounded properly. Chincha Kashaya was added and mixed well. Later, warm Tilataila was added and the whole combination was mixed well until the thick consistency was maintained. It can be spread over banana leaf. The above prepared warm mixture was kept over banana leaf and over cover Yaranda Patra was kept. This mixture was spread evenly over the leaf using a rolling pin. And preparation of subject. Patient is asked to lie down to supine position or to sit comfortably, exposing the affected knee joint, and slightly smear the warm Tilataila over affected knee joint, then Ubanaha Bandhana. Pradhana Karma, hot mixture is applied over the knee joint along with the banana leaf, and it is tightly bandaged with the cotton roll without causing discomfort to subject. The bandaging must be thick and should be extended 5 centimeter above the knee joint and 5 centimeter below the knee joint, and knot should be always be above the knee joint. Paschat Karma, patient is asked to retain the banaha for 12 hours, removing After removing Ubanaha from the knee joint, the part of the knee joint should be washed well with lukewarm water. Then observation and the result, it was found to be relieving the Shodha, Prasarana Kunchana Vedana, and improvement shown in the range of movements, tenderness, and working velocity. No improvement in crepitus. And discussion part, this Vedana is achieved by rise in temperature, which increase the metabolic activity, increase blood flow, and stimulation of neural receptor in skin. Svedana is very helpful in treating Shula, Shodha, Stamba, which are important symptoms of Janusantikata Vata. Selection of easily available dravya in the form of Ubanaha Sveda is affordable for all patients. Due to heat vasodilation on superficial region, which increase the blood circulation, and sweating happen and open the skin pores that transfer the medicated paste and nutrients to affected part. Lina dosha are liquefies and expel through pores of the sweat gland. Ginger, onion, garlic, turmeric, and sesame oil, sea salt has anti-inflammatory property. 6-gingerol is the major pharmacological active component of the ginger, is act as antioxidant effect. It inhibit the allergic reaction. Onion help reduce oxidative stress and boost antioxidant level and decrease bone loss, which may prevent osteoporosis, boost bone density, and inhibiting both acute and chronic pain. Garlic is biological activities including antifungal and antioxidant. Haridra is improving degenerative changes in the bone and joints. Then the tamarinthus is the anti-nociceptive. The process of blocking the detection of a painful or injurious stimulus by sensory neurons. Sesame oil reduce cell damage. Then wheat help to skeletal health, that is bone, tendon, cartilage, and collagen articulation and teeth, and shows antioxidant protection. Sea salt has reducing pain. And that finally the conclusion, the effectiveness of Ubanaha Sveda with a novel combination of ingredients in Janusantikata Vata is significantly reduced pain, swelling, tenderness, and improved range of movements and walking time. Drugs which are easily available in near stores and market can effectively manage health problem. Thank you.
Thank you, Dr. Deepak.
Thank you.
Next, I invite Dr. Chaitra B for the paper presentation.
Yeah, hello, ma'am.
Hello, doctor.
Yeah, I'll share my screen. Okay. Is it visible?
Yes, doctor, visible, doctor.
Yeah, it's shared.
Yeah. Hello, good evening, everybody. I'm Dr. Chaitra, presenting my paper on Jalauka Avacharana, a bliss of parasurgical procedure in the management of keloid. These are the content of my presentation. Coming to need of selecting topic, why I have chosen this case for presentation is an estimated 10% of population experience keloid and occurrence has equal gender distribution, and the internal genetic factors and external environmental factors influence the keloid epidemiology. And when we go through the treatment protocol of keloid, it is only a simple total excision or intramarginal surgical excision of keloid or intralesional steroid injection and cryotherapy, etc. But keloid shows a strong tendency to reoccur when they are surgically excised, that is 45 to 100%. So it is still a challenge to treat keloid without reoccurrence. And I feel this is an area of scope for Ayurvedic scholars to find a new intervention in keloid. Coming to introduction, keloid is fibroproliferative disorder of the skin that results from abnormal healing of injured or irritated skin. Keloid is characterized by proliferation of immature fibroblasts and also immature blood vessels. It has a claw-like process which is smooth, pink and raised patch as well as unsightly, often tender to touch and always itchy.
And studies suggest that genetic, systemic, and local factors may contribute for the development of growth of keloid. And keloid represent a pathological response to any of the cutaneous injuries. And key local factor may be mechanical stimuli. Vrana representing or being soul of Shalyatantra, the pathogenesis of keloid is similar to that of one of the Vrana Upadrava, that is Vrana Granthi, which has been explained as a growth of mass at the site of Vrana following diabetic complication or any physical irritation in the Vrana patient. So Vrana Granthi can be correlated with the keloid, which is explained by Acharya Vagbata in Ashtanga Hridaya Uttara Tantra 29th chapter. Coming to Jalaukavacharana procedure, as we know, Jalaukavacharana is Ashastrakruta Rakta Mokshana. It is one of the unique effective method of bloodletting, wherein which medicinal leech called Hirido medicinalis is used for the gentle method of bloodletting for the removal of vitiated blood. Coming to patient details, XYZ patient of 31, XYZ female patient of 31 years old, cleared by profession, approached our hospital on 28th March with a complaints of swelling over the chest region since 3 years, itching and irritation at the site of swelling since 1 year, pain on touch since 6 months. When we go through her Vedana Vrittanta, patient was free from above said complaints 3 years before. Then she gradually noticed a small pimple with a pricking pain at chest region. As she was not, as that was not much bothering, patient did not approach doctor. Later, when patient started wearing short Mangala Sutra, because of continuous friction to the skin, swelling was aggravated along with the pain and itching sensation. She went to a local doctor and took medication, but didn't felt any relief. So she approached our hospital for further line of management. Then her Purva Vyadhi Vrittanta was nothing any specific, and she didn't had any similar complaints before, and she was free from diabetic mellitus or hypertension or any other disorders like tuberculosis. And her Purva Chikitsa Vrittanta was normal, and she was not on any anticoagulants or anything. And coming to Kautumbika Vrittanta, here it is important because as the genetic factors influence, but here her family members were said to be normal or like free from above said complaints, and her Vayaktika Vrittanta was normal. After that, we did her general examination and the systemic examination. All were said to be in normal limits, and we did her local examination of the swelling. Site of swelling was over chest region, and shape was oval, and size was 1 into 3 centimeter in horizontal, and color was pink, and discharge was not there. And after palpation, tenderness was present, and consistency of swelling was firm. We did the investigation, which were under normal parameters, and RBD and HbSAg was done, and it was negative. After examination and all the investigation, we did Vyadhi Vinishchaya as keloid, that is Vrana Granthi. So we planned the treatment of Jalaukavacharana, wherein it was carried out from the solid protocol of Purva, Pradhana, and Paschat Karma. This is how, like, all the procedure, the standard procedure of Jalaukavacharana was carried out. So actually, Jalaukavacharana was planned on 2 sittings, 1 leech each time. So first, we applied 1 leech at the right side of keloid, and after first sitting, patient was having swelling was mildly reduced, and tenderness was also reduced. After 7 days, we again called her for follow-up, and we have examined the patient. Swelling and tenderness was reduced remarkably, and we applied we planned second sitting of Jaloka after on 7th day. On 7th day, the observation made was, during case study period, it has been observed that a pain and tenderness start decreasing after the first sitting of leech therapy. After last follow-up, there was significant decrease in the symptoms, including pain and tenderness, and there was complete reduction of itching and irritation. Here you can notice before treatment, the swelling was tender, and after treatment, we can see the remarkable reduction in the thickness and the redness of the swelling. And after treatment, after 15 days, we have advised patient to keep that site free from sweat. As she was clerk, sweating was more at the particular site, and because of that, she used to have much irritation, and we advised her to have a proper diet. results were like during first sitting 8 ml of bloodletting was done by Jaloka, and in second sitting 10 ml of blood was done, and on 15th day patient was free from all her symptomatically she was free. Coming to discussion, we know that leech saliva has many bioactive constituents like hirudin and calin, destabalase, hirustanin, and all these compounds will first anesthetic compounds will help for painless attachment of Jaloka, and hirudin having inhibits the blood coagulation, and the anti-inflammatory activities of delins will help for anti-inflammatory action. And many other different mechanisms like histamine being vasodilator, it will like tryptase inhibitors and proteinase inhibitors will help for the anti-inflammation action, and pain relief with the help of leech therapy will done by the mechanism called antioceptive effect and the counter irritation, and these anti-inflammatory substance will reduce the inflammation and increase the microcirculation. Other than this case, like in many of other keloid cases, we are practicing Jaloka Vicharana at our hospital, and patients are free from many of the complaints like pain, tenderness, and other things. Coming to conclusion, on the basis of above case study, we can conclude that leech therapy does a growth retardation of swelling, and it is beneficial in reduction of pain, tenderness, and itching. And this is best line of management for the size and thickness reduction of keloid. And we can improve the quality of life of the keloid patients and reduce the risk of reoccurrence. And it is simple, easy, effective day care parasurgical procedure. It is cost effective, less time consuming, and localized way of bloodletting to prevent surgical condition. With this, I want to conclude that Jaloka Charana is a divine boon to parasurgical procedure. Let us invoke it. These are the references. Thank you.
Thank you, Doctor. Next, I invite Dr. Rameshwar V. Jadhav. I invite Dr. Rameshwar.
Yes, ma'am. Yes, ma'am. Am I audible, ma'am?
Yes, Doctor.
Hello. Am I
Yes,
audible?
you are
Okay, 1 second. I will share my screen. Is my screen visible? Ma'am.
Hello,
is my
Doctor.
Screen visible? Is my screen visible, ma'am?
Yes, Doctor. Please start.
Can I start, ma'am? Myself, Dr. Rameshwar Jadhav, third year PG scholar in Kaya Chikitsa department from the College of Ayurveda and Research Center, Nigri, Pune. Today, I am here to present my presentation on the topic of role of Aushadha Sevankal in Chikitsa. Slide is moving, madam. Introduction. Aushadha Sevankal is a type of avastik kal. It is the proper time for drug administration. Everyone knows the three sutra of Ayurveda, that is Hetu, Linga, and Aushadha. The Aushadha Sevankal will help in food and drug interaction, which is help to attain a quick and sustainable relief from the patient. Relief to patient. Kal is an important factor which must be taken into consideration will file treatment. Kal is categorized as Nityak and Niyat and Aniyat Kal. Aniyat Kal also called Avastika Kal, and the Aushadha Sevankal is a subtype of Avastika Kal. Call for therapeutics management are considered as Aveksha call and Vesage call. This is again types of call. There are different number of call according to different acharyas. According to Charak, Susruta, and Ashtadhyayi, there are 10 number of Avsit 7 calls, and according to Ashtanga Sangraha, 11 number of Avsit 7. According to Sharangdar Samhita, there only 5 Avsit 7 calls are mentioned. According to Ashtanga Hridaya, Ashtanga Hridaya Sutra 13, Yujad Anannam Annado Madhye Ante Kavalantare Grase Grase Muhu Sannam Samudgam Nisicha Aushadam. The name of 10 Avsit 7 kal are Anannam, Annado, Madhye, Ante, Kavalantare, Grase Grase, Muhu, Sannam, Samudga, and Nisi. These are the, according to Ashtanga Hridaya, these are 10 Avsit 7 calls. This is slide different according to different acharyas names of Avsit 7 calls. According to Ashtanga Hridayam Sutra Stan 13, this is the indication of each Avsit 7 calls. Kapodrake Gade Anannam Balino Rogo Rogino Annado Vigune Apane Samane Madhye Ishyate Vane Ante Pratarasa se Sayamasya Tuttare Grasa Grasayantayo Prane Pradushte Matara Swini Muhur Muhur Visa Kshardi Hidma Trut Swas Kasisu Yogjam Sabho Bhojam Bheshajam Bhojam Svitre Arochoke Kampa Akshep Hidmasu Samudgam Lagu Bhojani Nam Urdav Jatrugat Vikaresu Swapnakale Prasasyate. This is the indication of Avsit 7 kal given in Ashtanga Hridaya Sutra Sthan 13. This is an important sloka of Avsit 7 kal. First, Anannam means on empty stomach for the disease arising from increased kapha dosha. That is the both bal, rogi bal and rog bal are more in this condition. Anan काल में औषध देना है. Annado just before food or at the beginning of food intake. In this disorder, apanvat disorder में use करना है. Anna madhye during, in between and in between food intake in disorder of samanvata. Ante at the end of food intake in disorder of vanvata at the end of morning meal, and in disorder of udhanvata at the end of evening meal. Fifth one is kavalantare in between morsels in disorder of pranavata. Sixth one is grase with each morsel in anorexia, loss of taste. It shall be mixed with different kind of tasty food. Seventh one is muhu, repeatedly many time of day. And disease produced by poisoning, vomiting, hiccups, etc. Eighth one is san, mixed with food in anorexia aruchi. Ninth one is samudga, before and after food in the kampa, akshep and hidma. And 10th one is nisikali, at night or bedtime for the disease of head and neck, that is Urdu Jatragat Vikar. This is some references. Thank you.
Thank you, Dr. Rameshwar. Then next I invite Dr. Pooja Uttam Rao for the paper presentation. I invite Dr. Pooja Uttam Rao.
Good evening, ma'am.
Good evening, doctor.
Good evening, ma'am.
Good evening, doctor.
Are you audible?
Yes, doctor.
Madam, please can you share my screen?
Doctor, 1 second. Doctor, we do have some technical problem now. So, can you present after some time?
Ma'am, I have sent the mail on Ashwini Parki's Ashwini There.
1 minute, doctor, 1 minute.
Ashwini There.
Okay, doctor, okay.
ashwinithere@gmail.com.
Please start the session, doctor.
Good evening, ma'am. Myself, Dr. Pooja Dhage, Department of Shalakya Tantra from Yashwant Ayurved College, Kadoli, Kolhapur, Maharashtra. My paper presentation name is a role of Ayurvedic management in madrosis, that is Pakshma Shata. Abstract, madrosis is defined as the absence of eyelashes or eyebrows or both. The term madrosis was originally coined to denote loss of eyelashes due to destruction of hair follicles. Madrosis may be manifested as local or systemic disease. Chronic blepharitis is one of the common cause of madrosis. It may be scarring or non-scarring. Scarring type depending upon the etiology. The word madrosis is of Greek origin, in which mados means to fall off. Introduction. Madrosis is a condition that causes people to lose the hair from their eyelashes or eyebrows. It can affect one side of the face or both sides. This condition may lead to either complete or partial loss of eyelash or eyebrows. Madrosis can also be either scaring or non-scaring. Non-scaring means that the internal hair structure remains, so the hair loss may be reversible. Scaring means that there is no more damage and the hair loss in the eyebrows or eyelashes may be permanent. Pakshma Shata is a condition where the eyelid and eyelashes are affected by vitiated pitta, consequently leading to the loss of falling down of eyelashes from eyelids. Pakshma Shata has not been explained by Sushruta in any eye disorder. The symptoms are, the most common symptoms of madrosis is loss of hair on your eyebrows and eyelashes. Pakshman Shatanam, eyelashes fall off from the eyelids following affliction of the eyelids by the vitiated pitta. Kandu, itching in eyelids. Daha, burning sensation in eyelids. And Shotha, swelling of eyelids. Ayurvedic treatment. Number 1, eyelashes fall. Ayurvedic treatment. Opening of eyelash root, that is Romakumpa Vikuttanam, using saline needle. The pore of the eyelashes, that is the site of attachment of eyelashes with the eyelid, should be dug deep into and the blood should be let out. Leech therapy, Jaloka Aucharnam. Site of eyelashes are subjected to blood leading by applying leeches on those sites. Modern correlation, Pakshma Shata, the eye disorder, can be closely related to a condition named madrosis, which is explained in modern medicine. Inflammation of eyelids can cause loss of eyelashes. It can be due to infection, trauma, or allergy. Infection due to Staphylococcus aureus resulting in thinning of eyelashes, trauma from rubbing or plucking may be the cause of unilateral or bilateral eyelash loss. Allergy, the loss of eyelash may be secondary to allergy to the use of eye cosmetics such as mascaras. Autoimmune disorders, despite lupus erythematosus, usually prevent with lesions on the sun-exposed area. And tumors, benign and malignant tumor of the eyelashes, such as chalazions, squamous cell carcinoma, lymphoma, and spread the carcinoma of the eyelids can be present with the loss of eyelashes. The treatment, artificial lashes affixed by methacrylate based adhesive or permanent pigment tattooing. Surgical repair of the traumatic madrosis can be done with good thickness of the eyelashes and ideal direction of their growth are difficult to achieve. The references are as follow, ma'am. The references are follows, ma'am. The Mukherjee book, that is the Clinical Examination Ophthalmology, second edition, and Basak Summer. Next page, ma'am, please.
Please continue.
Next is the image, ma'am. These are references. Thank you, madam.
Okay, doctor. Thank you so much. So, next I invite Dr. Shubhankar Mukund Naik. I invite Dr. Shubhankar.
Hello, am I audible?
Yes, doctor. Please share the screen.
Yes. Yes.
Hello, doctor.
Hello, doctor.
Dr. Shubhankar.
Dr. Shubhankar.
It's visible now.
It's
Please
visible now.
start.
Please start.
Hello, Dr. Shubhankar.
Hello, Dr. Shubhankar.
Hello, Dr. Shubhankar. Hello, Dr. Shubhankar. Okay, doctor. Please
Okay,
continue.
doctor.
Please continue. Doctor, we can't hear your voice.
Doctor, we can't hear your voice.
Hello, doctor.
Hello, doctor.
Doctor, we can't hear your voice.
Doctor, we can't hear your voice.
Doctor, we can't hear. Doctor,
Doctor, we can't hear, doctor.
please change your headset. Hello.
Dr. Shubhanga.
Dr. Shubhanga.
Dr. Shubhanga,
Am I
can you
audible now?
hear me?
Audible, doctor. Now audible, doctor.
Am I audible? Yes. Okay.
Okay, please continue, doctor.
Yes. There are the vernacular names of Karpur are as follows. Sanskrit in Karpur, Hindi is Karpur, Karpur, Karpuram, Kannada is Pache Karpura, in Marathi is Karpur. Then okay. Next, the Ayurvedic classification of Karpur according to Bhav Prakash is by its processing, which is Pakwa and Apakwa, which is artificially prepared or processed, and Apakwa, which means naturally occurring or unprocessed. And other type is Chinaka Karpur. Apakwa Karpur is superior in quality, that is in terms of guna, to Pakwa Karpur. Next is by Kayyadeva Nigantu. There are three types of Apakwa Karpur mentioned in Kayyadeva Nigantu, with subsequent decreasing in guna, that is Ishavas Karpur, Hima Karpur, and Potashraya Karpur. So Ishavas is the superior quality and Potashraya is the inferior quality of Karpur. Other three types mentioned are Bhaskar Karpur, Parana Karpur, and Chinaka Karpur. In Raj Nigantu, there are 14 types of Karpur mentioned in Raj Nigantu on the basis of Guna, Rasa, and Virya. That is Pitas, Bhimasena, Sitakar, Shankaravas, Pranshu, Pinja, Andasar, Hima, Yuta, Valuka, Jutika, Tushar, Him, Shital, and Pakvika. There are three more types mentioned in Raj Nigantu on the basis of part of plant from which Karpur is originating. That is Sheer, proximal part of stem, which is shining in texture, Vishada, clean, and Pulaka, erected or bloom. Madhya, middle part of stem, which is Samanya Pulakita, which is meant by averagely erected and clean. Tala, from the base of leaf, which is powdered and pale red in appearance. There are two more types mentioned in Rajanigantu on the basis of its origin in its trunk of the tree, which is situated inside the trunk, is superior in quality and which is sudrud, firm in nature, shubhra, white in color, ruksha, dry in nature, and pulakita, erected or bloom, we can say. Situated outside of trunk, which is medium in quality and which is clean, has a pale yellowish color similar to turmeric and white. Properties of superior quality of Karpur according to Rajnigantu are as follows. Clear in appearance, which is then the color which should be similar to Bhrungar Patra, light in weight, Vishada, with Tiktaras, bitter in taste, Shita, cool, Rudya with large number of pollen-like grains, with pleasantness and fragrant without sneha, without oil, sperm and white in nature. These Karpur will be of inferior quality if it has properties which are opposite to above mentioned one. And by its excessive consumption can lead to spot blisters or wounds on the skin. Sources of camphor. The synthetic camphor is synthesized mainly from alpha-pinene obtained from turpentine oil, while natural camphor that is obtained from distillation of the wood from camphor laurel tree. cinnamon camphora is found especially in Borneo and Taiwan. The Borneo camphor tree, or Diabolinus aromatica, the East African camphor wood tree, Octio in Asia, a major source of camphor is Ocimum kilimanjarium. Camphor is also present as a major essential oil component of many aromatic plant species, such as these ones. Major natural sources of camphor are camphor laurel tree. These are the pictures of it. Cinnamon camphora. These are the leaves, the flowering. The scientific classification of is as follows. Cinnamon camphora is native to China, south of Yangtze River, Taiwan, southern Japan, Korea, Vietnam, and it has been introduced in many countries. In India, it can be found in Dehradun, Kolkata, Saharanpur, Nilgiri, and Mysore. It grows up to 20 to 30 meter tall. The leaves are glossy, waxy appearance. In spring, it produces a bright green foliage with masses of small white flowers. It produces clusters of blackberry-like fruit around 1 centimeter in diameter. Its pale bark is very rough and fissured vertically. The next is Borneo camphor tree, Diabolinus aromatica. These are the flowering, fruiting. This is the camphor obtained from it. Its scientific classification is as follows. This description. Borneo camphor is a tall evergreen tree with a large globose crown. It usually reaches a height of 40 to 50 meters with occasional specimens up to 60 meters tall. It has a straight bole that can be unbranched for 30 meters and is usually 1 to 1.5 meters in diameter with exceptional specimens to 3 meters. The tree is a source of camphor used medicinally and in perfumes, and is also the most important source of high quality timber known as kapur, which is used locally and also traded. Camphor basil, Ocimum kilimanjarium. These are the leaf, flowering, and seeds. Its scientific classification is as follows. Camphor basil is an aromatic perennial shrub. Up to 2 meter tall stems are rounded, quadrangular, much branched, woody with epidermis, sometimes peeling off in strips below. Leaves are often with fascicles of young leaves or young shoots in axils. Blade ovate, sawtooth, tip blunt or rounded, base wedge shaped. Leaf stalks are 4 to 10 mm long. Flowers are borne in lax inflorescence. With distant holes 8 to 20 mm apart. Bracts usually deciduous. Flower stalks are 3 mm long, erect, slightly curved, flattened. Calyx is downward, pointing, 3 to 4 mm long at anthesis. Hairy, fruiting calyx is 5 mm long. Flowers are white, pink or mauve, 6 to 7 mm long. Tube straight, funnel shaped, scarcely exceeding calyx tube. Stamens protrude out 3 to 5 mm. Guna and karma of Karpur. Karpura Shitalo Vrushas Chakshusho Lekanodagu Surabir Madurastikta Kafapitta Vishapaha Dahat Rushnasya Vairasya Medo Daurgandya Nashanaha Karpuro Dvivida Prokta Pakwa Pakwa Prabedata Pakwat Karpurata Prahur Apakvam Gunavatram from the Bhav Prakash. Guna and karma of Karpura as follows. Its ras is Tikta, Katu and Madhur. Virya is Shita, Vipak Katu, Guna, Laghu, Shita, Karma, Lekhan, Chedan, Bhedan, Madakari and Rudya. Dosh, Kafagna, and it acts on Dosh as Kafagna, Pittagna, Dhatu. In Med, it is Medogna. In Shukra, it is Vrushya. In Mala, Sweda, Daurgandya Nashan. In Indriya, it is Chakshushya. Rogagnata, Dahat Rushna, Asya Vairasya, Visha, Shofa, Netra Rog, Mukha Rog, Atisar, and Pran. Physical properties of camphor are as follows. camphor toxicity can be a major problem. Its lethal dose LD50 is 1310 milligram per kilo, and lowest published is 800 mg per kg. Its acute toxicity symptoms, it may lead to abdominal pain, nausea, vomiting, giddiness, diminished vision, delirium, convulsions, cyanosis, hemiplegia, incontinence of urine, coma, and death. In chronic toxicity, if taken in small doses for a long period of time, may show symptoms such as lassitude, weakness, anemia, etc. Treatment is primarily supportive with a focus on airway management and seizure control. Skin and ocular decontamination should be done by flushing with copious amounts of water. Patients with camphor inhalation should be moved to fresh air. Induction of emesis should not be performed. Gastric lavage is not helpful as it is rapidly absorbed. Activated charcoal may be considered if there are other ingredients and that are effectively absorbed. Short-acting anticonvulsants like lorazepam should be used to treat seizures. Barbiturates should be used if benzodiazepines are unsuccessful, and hemodialysis is not of much benefit. This. So thank you so much.
Thank you, doctor. So before going to the next presentation, dear participants, I'm again reminding you your maximum time duration is 8 minutes. Please do follow that. So next I invite Dr. Roshni Prabhakar. I invite Dr. Roshni Prabhakar for the paper presentation.
Hello, ma'am.
Hello, doctor. Please share the screen, doctor.
Yes, sir.
Your screen
my
is visible,
screen
doctor. Visible, doctor. Please start the session.
Good evening, everyone. Myself Roshni Gajbir, PG scholar, Shalya Tantra. My guide is Dr. Rao sir and co-guide Dr. Nitam Kedar madam from Government Ayurved College, Nagpur. My presentation topic is Ayurved Management of Varicose Ulcer, a case study. Introduction: varicose ulcer is also known as staph ulcer or venous ulcer. Venous ulcer are occur due to improper functioning of venous wall, prevent the backflow of the blood, and this cause pressure in the veins that leads to tension and result in venous ulcer. It is most commonly seen in female population than men. The etiological factors include increased intravenous pressure, secondary to deep vein thrombosis, chronic constipation, long-standing occupation, etc. Clean breakdown or ulceration caused by varicose vein in which there is too much hydrostatic pressure in superficial venous system of the leg. Venous hypertension leads to increase the pressure in the capillary bed, transmission of fluid and protein into the interstitial to the skin and subcutaneous tissue, and eventually ulceration. If not treated properly, the ulcer may get infected, causing pain, swelling, redness, and first loss of mobility and leading to seveриtis or gangrene, and eventually may lead amputation of the part of the limb, etc. If conservative management like compression, antibiotic stopping, elevation, and regular dressing of wound fails, then surgical treatment like skin grafting, sclerotherapy, laser ablation, or surgical correction of superficial vein reflux is practiced. However, recurrence of venous ulcer is common. In Ayurvedic perspective, we can correlate venous ulcer with Piyagat Vatajanya Grant. Shushruta has elaborately explained Shashti Upakram, where Rakta motion is one of them. He has given upfront importance of bloodletting therapy and considered it as the most effective method of bloodletting, even in infective wounds and in abscess management. Method of cleaning of blood from the body using Jaloka is considered as the most easy and convenient one. Shushruta has elaborated that bloodletting by leaf can be practiced in all inflammatory suppuration and painful condition to relieve pain and inhibit suppuration, including that non-healing ulcerative lesions. In present case, patient was managed with leech therapy along with Ayurvedic medication in a very economic way. Aims management of varicose ulcer by Ayurvedic treatment and parasurgical procedure. Case report. Here the patient with of age 58 years female, occupation of teacher, complaint of pain and swelling over right leg, infected wound on medial aspect of right leg, serious discharge from wound and skin discoloration since 2 years. Brief history. Patient has suffering from above his complaint since last 2 years. She took medication treatment for the same since last 2 years, but wound got infected and was not healed in spite of the treatment around the 2 years. Hence, he comes to JC Nagpur for further treatment. There was no history of DMHN, TB, BA or previous surgery in past. General examination, all parameters were within normal limits. Arterial and venous color Doppler, incompetent perforation seen in posterior branch of greater saphenous vein in right the lower limb and no evidence of DVT. Local examination, a reddish large ulcer with sloping edge at middle aspect of lower right leg, size 3 to 2.5:1, shape oval, discharge present, serious discharge, edges sloping, local temperature normal. Patient also had swelling and reddish black discoloration around the right lower leg and tenderness around the ulcer. Varicosity on calf region of right lower limb. Arterial pulsation, dorsalis pedis and post-tibial normal. And diagnosis is non-healing venous ulcer. Materials and methods. After the assessment, wound was washed with normal saline, and thereafter 3 leeches were applied all over the lesion. After sucking, blood leeches left the site by their own, approximately 3 ml. Then wound was cleaned and dressing with gauze fish, soaking Karpurvita was done. Dressing was changed on every day. The leech therapy was repeated on alternate days for 7 sessions. Total duration for treatment was 15 days. Patient had advised to take Arogyavardhani Vatti 2 BD and Mahamadishadi Kashaya 15 ml BD internally. Daily adjustment to leech therapy. Here the picture of treatment, before treatment and leech application and after treatment. In discussion, in search of an effective Ayurvedic measure, Jalakaucharan was done and it came out with remarkable results in varicose ulcer. Jalakaucharan has its own benefits. Jalaka has anti-fluotistic that is used for relief of local inflammation in tissue. Jaloka has capacity of improving microcirculation. Jaloka sucks blood by self-regulating mechanism, that is, they get detached from wound on its own after sucking properly. Jaloka exerts local effect in the wound due to several active substances emitted into the during sucking. Hirudin acts as an anticoagulant, prevent the inflammation, and due to its thrombotic property, it is useful in thrombosis of artery and vein. Hyaluronidase makes the pathway for diffusion of all active substance inoculated by the leaf. It degrades the hyaluronic acid. It also be assumed that assume as the leaf sucks tangent blood, Shodhan of the morbid dosha has sucking blood occur, which in turn result in soto shuddhi and trap vata get released, which was responsible for pain. Karpurvita has granulocyte potential and antiseptic properties that stimulate local vessels and thus increase vascular supply required for healing. Arogyavardhani Vati provide total health and make the body free from all type of disease and bring a balance between those. Mahamadishadi Kashaya helps in maintaining the healthy blood supply circulation. It is also known as immune modulator and thus help body purify blood in natural way. Then conclusion. The presented combination of leech therapy and Ayurvedic medication on varicose ulcer completely healed within 15 days. Leech therapy proves to be effective, affordable, and acceptable treatment. None of the complications like severe bleeding, wound infection, or hypersensitivity were observed during the therapy. So it has been concluded that combination of leaf therapy and Ayurvedic medication are highly effective and varicose ulcer and has less complications. Thank you.
Thank you, doctor. Next, I invite Dr. Sheikh Majid Sheikh Abdul Rahman.
Hello. Hello, am
Hello,
I
doctor. You
audible?
are audible. Please share the screen.
Yes. My screen is
Doctor is visible.
Good evening, everyone. My name is Sheikh Majid Sheikh Abdul Rahman. My topic is a review on suturing techniques in ancient Ayurveda and modern science, guided by Dr. S.Y. Raut sir, Dean and Guide, and co-guided by Dr. Neeta ma'am from Government Ayurveda College, Nagpur. Introduction. A suture is also known as stitch made to join together open parts of wound which are caused after an injury or surgery. Acharya Sushrita, father of surgery and father of plastic surgery, has described Ashtavidha Shastra Karma, 8 surgical procedures are means and methods to treat surgical diseases at that time. Among Ashtavidha Karmas, Sivan Karma is primarily important in approximation of wound. Acharya described 7 dravyas which are required for Sivan Karma, that is Sivan Sutra and Sivan Suchi. Although suture material and aspects of the technique have changed, the primary goal remains the same as closing the dead space, supporting and strengthening the wounds. In Sushruta Samhita, basic techniques of suturing are described years back are still in use. In current surgical practices, modern science follows the same ancient principle without change. Aim and objectives: to study and correlate the various suturing techniques described in Sushruta Samhita and modern science. To study the suturing material described in Sushruta Samhita and modern science. Material and methods. All references are collected and compiled from Ayurvedic textbook like Sushruta Samhita, other Samhitas and modern textbook. Suture material is a medical device used to keep wound together until they heal themselves by natural fiber, that is collagen. Suture application generally involves using suture needle with an attached thread. Various shape and size of needles and different origins of thread were first time described by Acharya Sushrita. Sivan Dravya. Sivan Karma is performed with the help of Sivan Suchi and Sivan Sutra, that is thread, collectively known as Sivan Dravyas. Indications of Sivan Karma. Sivan Karma or suturing is done in diseases due to excessive fat, that is Metojanya Roga. Incised or cut wound, that is Bhinnavrana. Traumatic wound, that is Sadhyavrana, and wound localized on movable joints, etc. are also treated with suturing. Contraindication of Sivan Karma: wound caused by Shara, Agni, Visha, that is poison, Antarlohit Shalya, gangrene, wound which contain Panshu, Rome, hair loop, Nakha, that is nails, are contraindication for Sivan Karma. Types of Sivan Karma. First is, there are 4 types of Sivan Karma according to Ayurvedic texture. Ayurvedic literature. There are four Sivan Karma, that is Velitaka, Gofanika, Tunnasevni and Rujugranthi. Velitaka, it means continuous suturing. This is done by stitching continuously along the length of wound, wrapping the twisted edges inside it. Gofanika, they are suturing Gofanika, that is blanket kind of suturing. Tunnasevni is fitted in Vrana over the eyelids. Rujugranthi, it is interrupted suturing. In this, needle is embedded in Vrana edges and sutured, keeping some distance between 2 joints. Standard operating procedure of Sivan Karma. Sivan Karma procedure is explained by dividing into Purva Karma, Pradhan Karma, and Paschat Karma. Purva Karma, that is preoperative procedure. The surgeon desired to performing any of Ashtavidha Karma should collect Yantra, Shastra, Shar, Agni, Shalaka, etc. In case of Sivan Karma, Suchi and Sutra is most important. If wound is contaminated with Panshu, that is small stone, Roma, Nakha should be removed. After Samyak Vishodhana, proper cleaning of Vrana, wound edges are raised. Purva Karma is mainly cleaning of wound to prevent contamination and preparing it for Pradhan Karma. Pradhan Karma, that is the operative procedure. After Samyak Shodhana of wound, the main procedure of Sivan Karma is done with Suchi and Sivan Dravya. In this step, the Vrana is eventually stitched according to its need. Paschat Karma, post-operative procedure. After suturing, it has been done properly. Medicated Shom Pichu applied over wound. Then sprinkling of fine powder of Priyangu, Calicarpa macrophylla. Saviranjan, Yashti Madhu, Rudra, Shallaki Phal, and ash of linen cloth on the wound. Then bandaging of wound done appropriately. The patient advised the regimen of food and activities to be adhered. Modern view of suturing. Surgical suture is typical medical device for tissue repair. Most wound closure are still done with sutures. The mechanical properties of the inserted material are of the greatest importance in temporarily replacing the lost strength. Classification of suture material. There are three types of suture materials according to source or raw material: natural suture material, synthetic suture material according to its absorption, absorbable and non-absorbable sutures. Discussion. Acharya Sushruta had described the various suturing materials like hairs, cotton, guduchi, murwa, and linen thread, and various suturing techniques in detail. These suturing material are natural in origin and hence may create less tissue reaction, which promote early wound healing. Among major 8 procedures of wound healing, Sivan Karma is primarily important. Detailed description of Sivan Karma in Purva, Pradhan, Paschat Karma indicates the knowledge of Acharyas at that time. Knowledge of different types of Sivan Sutra and different size, shape of needle is important to do proper Sivan Karma, which Acharyas provide us sufficiently. The described suture material and techniques in our text can be utilized if it will be combined with modern scientific intervention as an integrated approach. Conclusion. We can conclude that Acharya Sushruta and others have very well aware about the management and care of wounds for its proper healing. For this purpose, Acharya Sushruta had given a complete idea of suturing procedure, needle, and suturing material. Sivan Karma and its indication, contraindication, and procedure are mentioned in different Ayurvedic Samhitas, which is relevant in modern era also. But modern advancements are also important to achieve the goal. Thank you. Thank you.
Thank you, Doctor. So next I invite Dr. Minal Nitin Patil. I invite Dr. Minal Nitin Patil.
Thank you, ma'am. Am I audible?
Yes, Doctor.
Screen is visible, Doctor. Please start the session.
Is my screen visible?
Yes, Doctor. Please start.
Hello everyone, I'm Dr. Meenal Patil from JSU Usmanabad PG Scholar, second year. I'm presenting a topic, psychosomatic feminism and its challenges, guided by Dr. Ravindra Dhindime sir, Professor and HOD of Kriyashari Department. I'll start my PPT with the introduction of Prakriti. As we all know that Prakriti iti Swabhavam, it is a specific for an individual that is expression of one's own characteristics. Now definition of Prakriti. Shukra Shonita Sayoge yo bhavid dosha utkataha Prakriti jayate te tasyam me lakshanam shrunuti. It shows that Prakriti is unchangeable characteristic which we all have got. Now we'll see types of Prakriti. There are two types of Prakriti, Doshaja and Gunaja. Both are divided in various categories. Like Doshish Prakriti are divided in 7 subtypes and Gunesh Prakriti in 3 different subtypes. Now they are further divided in 7 subtypes of Sattvaj, 6 subtypes of Rajas and 3 subtypes of Tamas. Now we'll see factors responsible for making of Prakriti. The factors that are responsible for making of Prakriti are sperm and ovum, season and condition of uterus, food and regimes of mother, role of Mahabhuta comprising fetus. Now we'll start with Manasik Prakriti. During the process of Garbhadharana, the dominance of one of the guna, that is Sattva, Raja or Tama guna, this Manas Prakriti is found. Manas Prakriti is also called as Gunamay Prakriti, as Deva Prakriti never changes. Similarly, Manas Prakriti also never changes. It remains stable throughout the life of an individual. Among these, 3 Rajas and Tamas are considered as Manas doshas because they spoil the Manas. While Sattva is virtuous, it is considered as pure, that is Guna of Mana. Now we'll discuss about Sattva Guna. Sattva is faultless and is considered as healthy. It is responsible for happiness, attachment towards the knowledge, leads to actions performed with firmness, selfness, and non-egoistic enthusiasm and noble motives, unaffected by the success or the failure of his efforts, and retains a sense of balance. Now Rajaguna. Raja is responsible for the hasty initiation of actions, restlessness, feeling of craving, and attachment to action. Rajasic mentality is always indulged in the strong passion in all work and its routine. Now Tamas Guna. Tamas is responsible for lethargy, sluggishness, slowness, and sleep, inactivity, hallucination, and unsteadiness. Tamasic person performs the action in unenthusiastic manner without sincerity of purpose or devotion. Hence, Tamasic person may be malicious, that is bitter. Now we'll discuss the location of mind. According to Bhal Sahita, site of Mana is head, and that of other Acharya it is Mana. Now Mana has 2 properties. Anutva, that is mindlessness, and Ekatva, that is singleness or oneness. Mind is so minute that it cannot be seen due to its macro size, and mind can move in the body very fast. It contributes with different sense organs to pursue knowledge rapidly. Mind conjugates with sense organs so rapidly that visualization, hearing, and perceiving the smell, all these processes seem to occur at a time. Mana is also known as Ubhendriya. Positive feelings are called Shubha, as well as happy state of mind. Negative feelings or unhappy state of mind is called as Dukkha. Psychological disturbances like anger and rage can affect heart rate and pulse rate. State of fear can lead to vasodilation and sweating. These examples show interconnection between body and mind. When mind is in the state of pleasure or when the mind is in the state of health, then this energetic state of mind reflects positivity on the physiology of the body. Stress, depression, anger, fear may lead to many disorders like insomnia, anorexia, etc. And they affect the body by producing diseases like gastric ulcer, arthritis, etc. Therefore, these disorders are called as psychosomatic disorders. Changes in Manasik Bhavas in women. Now, these changes of Manasik Bhavas occur in the stages like during menstruations, pregnancy, postpartum period, and menopause. Menstruation, which may include PMS, that is premenstrual syndrome, and PMD, premenstrual dysphoric disorder. Symptoms include excess of anger, fear, depression, unable to concentrate, breast tenderness, insomnia, headache, etc. In pregnancy during first trimester, sudden increase in fatigue, sometimes feel happy and alternatively sad, irritability. Second trimester includes anxiousness, worriedness. Third trimester includes physical discomfort and tiredness. Postpartum period, trouble in sleeping or too much sleeping, stress, depression, feeling of guilty or worthless, changes in appetite, crying uncontrollably, excess worried. Menopause, emptiness syndrome, insomnia, anxious, panic attacks, and phobia. Now we will start our topic, that is psychosomatic disorders, by its introduction. It's also called as the psychophysiological disorder or stress-related disorders, as some changes in physiological functions due to changes in physiological functions. Its definition is psychosomatic disorders, a group of physical symptoms in which emotional factors have an important role in its etiology. Now, the etiological factor includes psychological conflicts, stress, altered function of autonomic nervous system, cultural factor. Now, its clinical manifestations. The impact of its on cardiovascular system disorders are hypertension, coronary artery diseases, mitral valve prolapse, CVA. Respiratory system disorders include bronchial asthma, hyperventilation syndrome, rhinitis. GIT includes peptic ulcer diseases, ulcerative colitis, diseases, irritable bowel syndrome, endocrine disorders, diabetes, includes eczema, diarrhea, and pruritus. Now we'll discuss the emotion part. Emotions are extremely complex. The emotional core of the brain is the limbic system. Mood are personally are mediated through the prefrontal cortex. This part of the brain is the center of higher cognitive and emotional functions. This is the picture of the limbic system in brain. Now this is the picture showing different mechanism of brain performing different characteristics, different physiological functions in male and female. Now, treatment in modern science is anti-anxiety and antidepressant drugs, supportive psychotherapy, physiotherapy, have adequate sleep, counseling, proper exercise, proper diet, yoga, meditation, deep breathing exercise, spending more time with partner or friends, provide reassurance. Clinical importance of mind. Mind as well as body are location of sukha and dukkha. Sukha means positive feelings of mind. Negative feelings or negative attitude means dukkha. According to Ayurveda, state of dosha dhatu mala indriya and mind called as health or swasthya. Physiological importance of mind. Mind and body are interdependent. Sattva, rajas and tamas gunas of mind are related to pitta, vata and kapha respectively. Tridosh and Triguna can affect each other. Vriddhi and Kshaya of Tridosha affects Triguna. And vice versa. Therefore, health of body and mind must be maintained with proper food and exercise. Ashtanga Yoga is helpful to maintain balanced state of mind and body. Yama and Niyama of Ashtanga Yoga are useful for maintaining peace of mind. Asanas can keep body fit and flexible, and state of health can be achieved with Ashtanga Yoga. Healthy mental disposition. For a healthy living, it is the need that one not only have an equilibrium of dosha dhatu, but a healthy mind too, which can carry out its function effectively. A healthy mental disposition here includes the effective functioning of mind in accordance with the age, sex, religion, etc. Within the socio-cultural preview in which he lives, the factors influencing this include both the mind and the body. In the mind, this is the proportion of sattva, rajat, and tama. In the composition of mind, sattva has been given the status of guna as it is always associated with auspicious qualities. In the classics, there are many references where acharyas give a stress on the attaining of healthy mind. Some important classical references about the characteristic features of this healthy manas are the mounts are etc. Abnormal mental depositions. Here the word abnormal refers to any deviation from the normal or healthy features of mental deposition influenced by either rajas or tamas. Rajasic and tamasic prakriti and manovikara, or due to the lack of excellence of dhatu, that is deficiency of sara. Rajasic and tamasic prakritis. Both the persons either feel difficulty to carry out own activities or may cause nuisance in the society. So both these can be considered as abnormal mental depositions. Now manovikara. Acharya mentioned some abnormal states of mind called manovikara caused due to the rajas and tamas guna only, like kam, that is passion, krodh, anger, lobh, greed, moha, attachment, irsha, envy, mana, man, ego, mad, pride, shok, grief, chittaveg, anxiety, bhaya, fear, harsha, excitement, etc. These are not the disease states, but on excess increase are capable of causing diseases. Now we'll discuss the Prakriti Parikshan ka mahatva. Tasmad aturam parikshit prakritischa vikrutischa sahanatascha saratascha pramanatascha satmatascha sattvatascha ahara shaktischa vyayama shaktitascha vayastascha iti bala pramana vishesha grahana heto. Prakriti, with the help of Prakriti, we can decide whether the one is healthy or not, and we can prevent him or her from any kind of disease. Viparita gunastesham swastha vritti vidahitah samasarva rasam satmyam samadhato prashasyate. Thank you for letting me present my PPT.
Thank you, Doctor. So before get start, let me again remind you, you have maximum of 8 minutes. Dear participants, please do follow it. And next I invite Dr. Shubhangini.
Yes, ma'am.
Doctor, please start. You are audible.
Yes, I have started. Is my screen visible, ma'am?
Yes, doctor, visible.
So, hello everyone. Myself, Dr. Shubhangini Eskola, second year PG scholar, Department of Kaya Chikitsa from the BVS Ayurveda Medical College and Hospital, Bagalkot. Today here I am presenting the topic Trivida Chikitsa in Manas Roga. Contents of my topic is introduction, prevalence rate of mental illnesses, Karana and Samprapti of Manas Roga, Chikitsa of Manas Roga, and the Trivida Chikitsa, that is Daivapashra Chikitsa, Yuktivapashra Chikitsa, Satvavajay Chikitsa, then probable mode of action of Satvavajay Chikitsa, conclusion and references. Coming to the introduction, in Sushruta Sutrasthana 15th chapter, he has mentioned Samadosha Samagnisha Samadhatu Malakriya Prasannatmendriya Manaha Swastaita Vidiyate. So he has also given the importance for the mental well-being also, along with the physical and spiritual well-being. Manasa plays an important role in the pathogenesis of both mental as well as the physical disease. How means Kala Buddhi Indriya Arthana Yogo Mityana cha Aticha Dvaya Ashrayanam Vyadinam Trivida Hetu Sangraha. Mithya Yoga, Ayoga and Atiyoga of actions by the Indriya Vishaya, Mana and Vani, Sharira and by Kala, these are the causative factors for all Sharirika as well as the Manasika doshas. Then Manasa Vikara are considered to be produced by the impairment of general mental functions resulting from emotional disturbance due to the derangements of Rajo and Tamodosha. Mana has a 3 guna, that is Sattva and Rajata. Raja and Tama. But the Raja and Tama are having Krodamsha and Mohamsha respectively. So these are going to be vitiated in the formation of the mental illnesses. Ayurveda has a unique holistic approach in treating, preventing, and promoting mental health. There are 3 therapeutic streams mentioned in the Ayurveda for the management of Manasika Vikara. Those are entitled in the name of Trividha Chikitsa. That is Daivapashya Chikitsa, Yuktivapashya Chikitsa, and Sattvavjaya Chikitsa. Then why Manasa Roga treatment is important means in the 10% of the world's population is affected by the mental illnesses. In India, 56 million population are suffering from the depression and 38 million population are suffering from the anxiety disorders. 7.5% of the Indian population suffer from major or minor mental disorders that require medical intervention. And in India, every 6th Indian needs mental health help. Then definition of the Manasaroga, it is an abnormal mental condition characterized by the vitiation of Sharirika and Manasika doshas as well. Impairment of mano karmas, that is abnormality of the Chinta, Uhe, Vichara and Sankalpa, and the presence of Alpasattva and abnormal Cheshta, Buddhi, Achara and Bhakti leads to the Manasa Vikaras. Karana of Manasa Rogas, that is Istasya Alabhat, Labhat Anishtasya, means loss of undesirable things leads to the Krodha or Moha or Isha, in turns lead to the Manovikaras, and acquisition of undesirable things leading to the Dosha, Dvesha and Shoka etc., in turns leading to the Manovikar. And in case of Alpasattva, Manorogas will happen. Vitiation of the Sharirika and Manasika doshas, it is Raja and Tama, and Baya, Shokadi, Karana, etc. Then coming to the Samprapti of the Manasarogas. In today's era, there is occupational stress in every person. So that may lead to the Manasa dosha prakopa, which shades the Raja and Tama doshas, as well as the Sharirika dosha prakopa, which shades the Vatadi dosha, which in turn lodges in the Hridaya, which is a sthana for Manovashotas. It afflicts the Manovashotas, which disturbs in Buddhi, Smriti, etc. and thus manifests the Manasika Roga. Then coming to the Chikitsa of Manasa Roga, Ayurvedic treatment for mental disorders are aimed at mitigating the symptoms, eradication of the disease, personality development. These are achieved with the help of following Trividha Chikitsa, that is Daivapashya Chikitsa, spiritual therapy, Yuktivapashya Chikitsa, pharmacological therapy, Sattvavjaya Chikitsa, that is psychotherapy. In detail, we'll deal with the 3 Chikitsas. Daivapashya Chikitsa, Tatra Daivapashya, Mantra Aushadha Mani Mangala, Bali Upahara, Homa Niyamana, Prayashita, Upavasasya, Pranipata Gamanadi. Spiritual therapy that includes the use of mantra, japa, other religious activities, and wearing of precious stones, etc. This method creates the confidence and removes the fear in the person and pessimistic tendencies. Chanting mantras, how it helps means it boosts the positive waves and energy and removes the negative thoughts. It thus enhances the sattva guna, leading to the devoid of the manasarugas. Manidharana, it acts on dushta grahas, it positive impact on the mind. Homavana, purification of the environment and self by the use of Grita, Gugulu, Chandana, etc. In Shushruta Sutrasthana, he has mentioned Rakshogna Ganadragas. There we can use these medicines. Then for the Homa Havana, Swasthayana, that is Mangala Prada, it calms the mind. Upahara, it gives a happiness to the mind and acts as a tarpana. Then Pranipata Gamana, it changes in the environment which leads to the happiness to the mind and it creates pressure points in the souls. Yuktivapashya Chikitsa, Yuktivapashyam Punarahara Aushadha Dravyana Yojana. This includes treatment through logical use of medicines and the modifications of ahara and vihara to suit the needs of the person. The patient should be engaged to follow proper ahara vihara, medhya rasayana, doshara aushadhi to control the imbalanced mind. Then ahara, how it helps means it helps to stay healthy and improves it and prevent illness and easy recovery. Then proper vihara calms the mind and focuses the mind. It diminishes the anxiety, distress, and blood pressure, and influence the neurotransmitters. Due to the any stress, there will be neurotransmitter changes. Thus, it leads to the influence of the neurotransmitter, and it reduces the oxidative stress. Doshahara Aushadis, in that Shamana Chikitsa, use of Gruta, like Kalyanaka Gruta, Mahakalyanaka Gruta, Panchagavya Gruta, Mahapaishachika Gruta, other Aushadis having the tranquility effect on the mind, reduces the Udvega. It acts on the Buddhi, Di, Driti, Smriti, and Meda. Shodhana Chikitsa, which includes the Panchakarma and Murdi Taila. Brahmi Taila, Jyotishmati Taila, these are used for the Siraseka, which in turns lead to the Manobuddhi Prasadana Avasadakahara. Medhya Rasana, it calms the mind, tranquility, or the stimulation of brain activities. There are four Medhya Rasanas: Guduchi, Mandukaparni, Yashtimadu. Then Satvavaja Chikitsa, Satvavajayaha Punarahitebhyo Arthyobhyo Mano Nigraha. Satvavaja Chikitsa has defined as the method of controlling or restraining the mind from the unwholesome objects. The Satvavajaya includes all the methods of Mano Nigraha, Didhairya Atmadi Vijnana, Sadruta Palana, and Acharasana. Mano Nigraha by giving the chikitsas like Ashwasana, Harshana Chikitsa, then Pradidvandva Chikitsa, etc. How it acts means Sattvaja Chikitsa inhibits the functions of impaired mental attributes, that is Raja and Tama, and it corrects the imbalanced emotions of Di, Dhriti, and Smriti and Pradyaparada, which rectifies the Sattva Guna and motivates it through the Dhairya and Samadhi, resulting in controlling of Manas from the Ahita Arthas. That is the main aim of Sattvaja Chikitsa, that is Mano Nigraha, which in turn increases the Sattva Guna in the person. Then the person become devoid of Manasaroga. Conclusion: Ayurveda provide better treatment modality in controlling or curing in mental disorders. By Ayurvedic line of treatment with a spiritual therapy, pharmacological therapy, and psychotherapy, one can able to treat mental diseases effectively. Trivida Chikitsa plays an important role in maintaining of a harmonious state between the sattva and the mana, ultimately leading to the happy and healthy state of the mind. These are the references I have used: Charaka Sutrasana 11th chapter, Shushruta Sutrasana 15th chapter, and the journal. Thank you.
Thank you, Doctor. So next I invite Dr. Radhika for the paper presentation.
Yes, madam. Am I audible?
Audible, Doctor.
Yes, doctor.
Please share the screen,
Please
Doctor.
share the screen.
Is it visible?
Yes, Doctor.
Thank you, ma'am, for the call. Hello, friends. Myself, Dr. Radhika Pungliya, second year PG scholar from the Department of Kaya Chikitsa. So my topic is hypertension and Ayurvedic approach. Guide, Dr. S.S. Kalyani, Professor and HOD, Department of Kaya Chikitsa. So contents are following. So we'll see one by one. So introduction. Hypertension is, as we all know, hypertension is one of the most common lifestyle disorder. Every fifth person is found to be hypertensive. Most adults develop it in last half of their life. The prevalence rate along with its adverse effects are increasing at an alarming rate. The adverse effects of hypertension principally involve the blood vessels, CNS system, retina, kidney, heart diseases. In modern science, we can get many of the references related to hypertension, but in Ayurvedic text, there is no clear pronunciation about hypertension. But it might be present from the time when the life is existing in the universe. Why? Because the diseases like Pakshaghata, Mutraghata, Rudroga are very well explained by our Acharyas, which are common complications secondary to the hypertension. Next, nomenclature, which is still an unresolved question. In Ayurveda, some of the academicians of Ayurveda nominated some of the Names, those are Pittavruta Vata, Raktavruta Vata, Siragata Vata, Raktagata Vata, Vanavruddhi, Raktachapa, Raktavruddhi, and Dhamani Pratichaya. But according to Charakacharya, he explained in Trishotini Adhyaya that every disease cannot be identified, or it is not possible all the time to identify a disease by its name. We have to build up the Samprapti based on the clinical features, investigative findings, and thus we have to treat according to the condition. Before going to the pathological aspect of hypertension, we have to see physiological aspect. So, concept of blood pressure in Ayurveda. So, pumping action of heart. As we all know, heart is having its own pacemaker, that is SA node. It is having the capacity of generating the, electrical impulses that does the contraction of muscles of heart. So that is a function of Vanavata as Vano Rudya Sitaha Krishna Dehachari Mahajava. And the heart rate is under the control of autonomic nervous system. So we can take it as under the consideration of Pranavata. Next, peripheral resistance. It is done by Avalambaka kapha. That is, the kapha is made having the function of maintaining the structural integrity in the body. So as Avalambaka kapha is situated in Hridaya. Elasticity of large arteries. The vascular tone is also under the control of autonomic nervous system. So it is a function of Pranavata. Volume of circulating blood. It is determined by the quality and the quantity of rasa and rakta dhatu. If the rasa dhatu increases in the body or in the body, it causes the gauravata. And if the rakta dhatu increases, it causes sirapurnata. So viscosity of blood partly determines the resistance to the blood flow. If the pichila guna, that is because of sama dosha or else vishandita kapha increases, that causes increased output. So next, blood pressure regulation and the role of tridosha. So it takes place with the help of multiple mechanisms in the body. First is short-term regulation, which takes place with the help of neural mechanism, that is by the pranavata. Pranavata takes help of kapha as the baroreceptor, and it takes help of pitta in chemoreceptors. Second is long-term regulation. Pressure first is by pressure diuretics and pressure natriuresis. The kidney is the main excretory organ which excrete the urine by reducing the volume of the blood and the fluid in the body. That is a function of apanavata. And hormonal mechanism, more than 15 types of hormone are secreted in the human body. So that is a function of pitta dosha. Next, as we all know, the essential hypertension is still idiopathic in nature, but the etiological risk factors are very well known, which are excess intake of madhyapana, sedentary lifestyle, that is excess intake of madhurahara, snigdahara, and divaswapna, excess intake of lavana, kshara, amliya dravyas, physical strain, and mental stress, that is stress, that is krodha, bhaya, etc. And nidanarthaka rogas like madhumeha, staulya, hridroga, etc. Now the samprapti, along with those nidanas, genetical defects and even the ritusandhi are causing the hypertension. These follows the samprapti based on rakta pathway, pittaja pathway, vataja pathway, and kaphaja pathway, and causes increased cardiac output and peripheral resistance and cause hypertension. Next are lakshanas of hypertension. Those include shiroruk, shrama, krodha prachurata, jwara, brahma, klama, akshigraha, tamasa atidarshana, kampa, ardhita, raktameha. Mada Murcha Sannyasa, these can be taken under consideration of crisis of hypertension, that is malignant hypertension. Next comes the Avarna concept in the hypertension. Anya dosha Avarna can take place because of increased hormonal and enzymal action, that is because of Pitta Prakopa, and decreased sodium excretion from the body, that is because of Pitta and Rakta Prakopa. Atherosclerotic changes in the artery, that is maybe because of kapha or as well as Meda Dhatu. And Anyonya Avarna, that is because of hampered autonomic nervous system, that may be because of in between the pranavata as well as the panavata. Next comes the chikitsa. Chikitsa of hypertension should be planned according to the dosha and dosha involved. So first is nidana parivachana. We have to suggest the patient to avoid the nidanas. Lifestyle modification we'll see in the next slides. Shodhana chikitsa and the shamana chikitsa. First is the mode of action of Virechana. Virechana, as we all know, Virechana is best line of treatment for Pitta dosha as well as the Rakta Dhatu, which clears the Margavarodha and eliminates the morbid doshas from the Rakta and regulates the activity and the movement of Vata. When we explain in terms of modern, during the Virechana process, there will be inflammation of the intestinal mucosa that leads to the hyperemia and exudation, resulting into the increased passage of fluids through the vessel walls into the lumen of the intestine that causes increase in fluid volume, also results in the dilution of toxic materials that will be evacuated out of the body and decrease the fluid level from the blood. Next, the mode of action of the Basti. Basti is very well chikitsa for the Vata dosha. The long-term regulation of blood pressure occurs through the renin-angiotensin-aldosterone axis. When we insert the Basti into the body, that triggers the parasympathetic nerve and that causes the decrease in RAA complex and activates the depressor of the vasomotor center and cause the vasodilatation and decreases the blood pressure. Next is Rakta Punkshana. We preferably use sorry, Siravedana. So Rakta Mokshana is not only limited to the puncturing site but also show the effect on the whole body. In hypertension, bloodletting leads to the reduction in blood volume. Next is mode of action of Shirodhara, which is beneficial for both Vata and Pitta dosha. A particular pressure and the vibration is created over the forehead. Those vibrations are amplified by the hollow sinus present in the frontal bone. Then the vibration are transmitted into the cerebrospinal fluid. Thus, the vibration along with the little temperature may activate the functions of thalamus and basal forebrain. Those causes the serotonin and catecholamine level decreased and cause the normal stage inducing the sleep. Next, the Shamana yogas. Those include single drugs like Sarpagandha Churna, Ashwagandha Churna, Jatamansi Churna, Arjuna Kshirapaka, and the Rasona Kshirapaka. Compound formulations like Sarpagandha Ghanavati, Brahmi Vati, Prabhakara Vati, Arjunarishta, Vidyavarna Rasa, and the Mukta Bhasma. Many more are there. And the prevention of hypertension, the practice of dinacharya and ritucharyas are important, reducing the stress and lifestyle modifications like reducing stress, exercising regularly along with the pranayama, eating a healthy diet, limit of salt and lipid intake, losing weight, limiting alcohol, DASH diet, stopping smoking and alcohol, and cutting down of caffeine. Discussion, improper lifestyle and food habits, psychological stress factors, etc., with or without genetic predisposition, provokes and vitiates all the three doshas to trigger the pathogenesis of hypertension. Anya dosha avarana and Anyonya avarana are the mechanisms of pathogenesis. With the help of recent advancements in the medical science, the diagnosis of hypertension made possible at an early stage, and thus effective management can be offered at this stage itself to avoid risk of damaged vital organs. Thus, hypertension can be understood as a psychosomatic hemodynamic condition where Vata Pradhana Tridoshas are vitiated, affecting Rasa Rakta Dhatus as Dushyas, with both Sarva Sharira and Manas as its Adhisthana. Conclusion, the disease hypertension is abnormality of Rakta Dhatu, popularly known as Shonita Dushti. So, these treatment modalities helps in prevention of hypertension if they are followed according to Ritucharya, and even helps in prevention of further prognosis of hypertension. Shonita Kapha Prasadajam Hridayam. The adopted treatment modalities are acting on Mula of its origin itself. So these can offer more reliable results. So these are references which I have used. Thank you.
Thank you, Dr. Radhika. And dear participants, again and again I am repeating, please follow the time duration. And next I invite Dr. Rujita Mondal for the paper presentation. I invite Dr. Rujita.
Yes, ma'am.
Hello, Dr. Rujita. So next I invite Dr. Mahalakshmi. I invite Dr. Mahalakshmi.
Hello, ma'am. Am I audible, ma'am?
Yes, doctor, you are audible and your screen is visible. Please start.
Okay, ma'am. Good evening to all. I am Dr. Mahalakshmi, second year PG scholar, Shalyatantra Department from BVVS Ayurveda Medical College and Hospital, Bagalkot, Karnataka. Today I am presenting a paper on Kshara Sutra, a wonder medicated thread in the management of vagina-anal fistula, a case study guided by Dr. Pallavi A. Hegde, Professor, Department of PG Studies in Shalyatantra. These are the contents of my talk presentation. Coming to the introduction, Acharya Shushruta has explained Bagandhara as one of the Ashtamahagata because of its recurrence rate. The word Baga includes all the structures around the Guda, including Yoni and Basti. Dharana means tear of surface associated with pain. When a Shofayukta when a Vedana Yukta Shofa, that is painful swelling, is formed in Guda Pradesha, when it becomes Pakwa, that causes Dharana, that is pain in the Bhaga, Guda and Basti Pradesha, that is called as Bagandhara. And Acharya Shushruta in Shushruta Chikitsa 17th chapter, he has explained about Kshara Sutra in the management of Bagandhara. In India, the Kshara Sutra is having high success rate, that is about 96.67% of success rate in the management of Bagandhara. Nowadays, Kshara Sutra is the first choice of therapy in the treatment of Bagandhara. That is, in case of fistula and ano, Kshara Sutra is the first choice of therapy. Coming to the patient details, a 36 years female came to our OPD with a complaint of boil or abscess in the perianal region since 8 days, and it was also associated with pain and foul swelling post discharge, and she was also having complaint of passing of hard stools since more than 2 years. Coming to the Vedana Vrittanta, patient was apparently normal 8 days back. Then she gradually developed with boil in the perianal region, which was associated with pain and foul smelling post discharge. Pain was severe, continuous, and throbbing in nature. For this, she consulted a doctor near to her home and advised with oral medications. But she didn't get relief. Then the doctor has advised her to consult our hospital. So she approached our hospital for further management. Coming to the Purva Vyadhi Vrittanta, she is having history of recurrent perianal abscess. For that, she has undergone IND twice in the year of 2015 and 2017. Kautumbika Vrittanta, all the family members are said to be healthy. Menstrual history, she is having regular period of 28 to 30 days cycle with a bleeding of 3 to 4 days. Coming to the examinations, general and systemic examinations were within normal parameters. Local examination, on inspection, there was a single abscess at perianal region in the left labia majora, lower part of the left labia majora, and it was pinkish red in color associated with foul swelling post discharge. On palpation, tenderness was present. On per-rectal examination, sphincter tone was normal and tender dimpling was present at 1 o'clock position. On probing through the external opening, internal opening was found at 1 o'clock position in the anal canal. Sambhavya Vyadhi, vaginoanal fistula and Bartholin cyst or abscess. Vyadhi Vinishchaya, vaginoanal fistula. We advise the patient for hematological and MRI fistulogram, and reports were found that all hematological reports were within normal limits, and MRI fistulogram suggested that there was a grade 1 intersphincteric perianal fistula with length around 4 cm. Coming to the Samprakti of the Bagandhara, because of the Nidana Sevana, vitiation of doshas takes place. And these vitiated doshas get localized in the Guda Pradesha and causes dushana of the Gudagata Mamsa and Shonita. And that leads to formation of Bagandhara Pidaka. When the Pidaka become Pakva, it should be treated. If not, that leads to the Vrana formation and leads to the Upadravas like Bagandhara. And for this patient, we planned for Kshara Sutra therapy. After taking the consent and after giving the Avagaha Sveda with Panchavalkala Vata, patient was taken in lithotomy position, and after painting and draping, betadine was pushed from external opening, and under local anesthesia, probing was done through the external opening and Kshara Sutra was placed in the tract. Patient was advised with Vakahasveda with Panchavalkala Kvata and dressing with Jatadi Taila daily. Along with the procedure, oral medications like tab Anuloma DS 1HS and tab Graf 1BD and tab Triphala Gugulu TTID were advised, and patient was advised to came to hospital on every 8th day for thread changing. Coming to the observation and result, the Kshara Sutra was changed every week, and there was gradual decrease in the length of the tract along with the simultaneous healing. After the 8th sitting of Kshara Sutra changing, there was almost 90% reduction in the length of the tract, and only around half centimeter was remained. That time we have done the fistulotomy under local anesthesia, and patient was advised with dressing with BC 56 ointment, and the wound got healed within 1.5 months completely without any recurrence rate. Here in these images, we can see the changes, that is reduction in the length of the tract along with the healing at different settings of Kshara Sutra therapy. And in these images, we can see the changes in the healing process of the wound. At the end of the 1.5 month, there was complete healing in the ulcer, that is healing the wounds. Coming to the assessment, initially the length of the tract was around 4.5 centimeter with severe pain and pus discharge, but at the end of the 8th setting of the thread changing, the length of the tract was around half centimeter with no pain and pus discharge. Coming to the mode of action of Kshara Sutra, it is a local drug delivery. Kshara Sutra therapy, it is a local drug delivery system. It is a herbal chemical cauterization process. It facilitates the drainage of infection and promotes the healing, and it cuts the fistula tract naturally. Here we have used Apamarga Kshara Sutra. That in that Apamarga Kshara, it is having properties like Chedana, Vedana, Lekana, and Tridoshagna, and which clears the fistula tract and liquefies the thick pus and keeps the tract clean and helps in the drainage of the pus, and hence causes the chemical fistulotomy. And Haritra, it is having properties like Rakta Shodaka, Shotahara, Vatahara, Vishagna, and Ranaropaka, and it acts as anti-allergic, antiseptic, and it is a best wound healer. And Arkakshira, it is Kshopahara, Pranahara, Kanduhara, and Krimihara, and it is a proteolytic, and it dissolves the tissues of fistulous tract. And physical presence of this Kshara Sutra in the tract, it keeps the passage patent and helps in the drainage of the pus. Coming to the discussion, the combined effect of all these ingredients was found effective in the cutting and healing of the fistulous tract, and it cuts the unhealthy portion of the tract and provides this simultaneous healing. Avagahasveda with Panchavalkala Kvata helps to clean the pus discharge and associated debris from the tract, and it reduces the local congestion and inflammation of the perineal region. To conclude, Kshara Sutra therapy is a simple, easy, and effective OPD-based parasurgical procedure with minimal surgical intervention with high success rate. It is a sphincter-saving procedure, and it prevents the recurrence and anal incontinence also. And you can say that the Kshara Sutra therapy is a gold standard parasurgical procedure in the management of anorectal disorders. These are the references that I have referred, and thank you.
Thank you, doctor. So next, I invite Dr. Akran Singh. I invite Dr. Akram Singh. Hello, Dr. Akram. So next I invite Dr. Swati.
Yes, ma'am.
Doctor, please start. Your
Yes, ma'am.
audio is clear.
Okay, ma'am. Okay. I'm going to share my screen. Okay. Yes. Wait a second, ma'am. Okay, चालू है ना, wait lang. Is my screen visible, ma'am? Is my screen visible, ma'am? Yes. I'm Dr. Swati Dongre, PG Scholar, Department of Sanskrit Sahita Siddhanta, BM.
Doctor, is not visible.
Is not visible, ma'am?
No, doctor.
Okay, okay, ma'am. Okay, I'm trying. Okay. To share it. Share screen. Share screen. Okay. I'm doing, ma'am. करना नाही ते शेअर ऑल्ट प्लस काहीतरी लिहून आलं तिथे ऑल्ट प्लस एस शेअर शेअर इज इट विजिबल मॅम
Yeah, it's visible now. Please start.
Okay, ma'am. I'm Dr. Swati Dongre, PG Scholar, Department of Sanskrit Sahita Siddhanta, BM, Nandanvan, Nagpur, ma'am. I am here to present a topic, a review on polycystic ovary syndrome and Ayurveda approach towards its management. The abstract is, according to Ayurvedic view, PCOS can be correlated with the Arthakshay. Polycystic ovarian syndrome is one of the most common female endocrine hormonal disorders, affecting up to 20% of women in their reproductive age, which leads to the primary or secondary infertility. PCOS is a hormonal condition that affects women of childbearing age, excess androgen, and menstrual cycle that are either infrequent or longer than normal are common symptoms. Then the keywords are polycystic ovarian syndrome, infertility, artavadhatu, rasa, rakta, and vata. The introduction, now coming to the introduction, the Ayurvedic system of medication is based on many centuries of experience in medical practice handed down through generations. In Indian culture, marriage is a religious ceremony obligatory to each individual for completion of the life cycle to obtain the Purushartha Chatushta, one of the four principles of the human beings. Since the Vedic era and later in Sahita Kala, Ayurveda has placed greater emphasis on various three prasuta diseases. The mother is regarded as one of the most important factors in the production of offspring. Since the Vedic era and later in Sahita Kala, Ayurveda has placed greater emphasis on various three prasuta diseases. The mother is regarded as one of the most important factors in the production of offspring. Polycystic ovarian syndrome, that is the PCOS in Ayurveda, was correlated with Arthaksaya. Arthaksaya has been described as deficiency or loss of Artava. Artava does not appear in the time or it is sometimes delayed. According to Ayurveda, Arthaksaya is a disorder involving Pitta and Kapha doshas, Medas, Ambu or Rasa, Artava and Rasa, Rakta and Artava Bahasrotasa. Polycystic ovarian syndrome, PCOS, signs have a natural tendency to start progressively. Hormone shifts that intensify PCOS typically begin in the early young
after the first menstrual cycle. Indications can be more evident after gaining weight. Various studies in India reveal that prevalence of dysmenorrheal conditions varies from 33% to 79.67%. Then the objectives are to revive the polycystic ovary syndrome and Arthavkshaya and Ayurveda approach towards its management, to revive Ayurveda approach towards management of polycystic ovary syndrome and Arthavkshaya. Now, the methodology is the literary and the conceptual study done on polycystic ovary syndrome and Arthavkshaya from the Brihatrayas, Laghutrayas, and other classical books, including journals, presented papers, previous work done, and correlated, analyzed with the science on the subject. Artava in Ayurveda. According to Ashtanga Sangraha, Rakta reaching Garbhasha and coming out for 3 days in every month is called Artava. The Raja is formed from essence part of Rasa. Arun Datta opines that this Raja is formed from Ahar Ras and not from the Rasa Dhatu. And the Acharya Sharangdhar and the Bhav Mishra mention the Raja as by the Upadhatu of Rakta. According to Acharya Kashyapa, Rakta enters in the Garbhakoshta every month by the Rajovasiras present in the Garbhasha, and after the completion of 1 month, the Artava is expelled out by them. Then coming on the topic formation of Raja and Sri Shukra. The crucial factors in the process of conception as described in Ayurveda are Rutu, that is the fertile period, Kshetra means healthy reproductive organs, Ambu, the proper nutrient fluid, Bija, that is the ovum or sperm. Abnormality in any one of these can cause infertility. The term Bija can be correlated with the spermatozoa in male and ova in woman. In classics, Raja or Artava, that is the menstrual blood, is said to be formed from Rasa or Rakta. From the Rasa Dhatu, the Rakta named as Raja is formed in the woman body. Rakta reaching uterus and coming out for 3 days in every month is called Artava. The same way in modern medicine, the duration of menstruation is about 4 to 5 days, but anything between 2 to 7 days is accepted as normal. The modern text depicts that the first menstruation occurs between 11 to 15 years with a mean of 13 years. For the past couple of decades, the age of menarche is gradually declined with the improvement of nutrition, lifestyle, modifications, and environmental conditions. Occasionally, the menarche may be delayed up to age of 18 years. Ovulation is the release of egg from the ovaries. In human, ovulation occurs about midway through the menstrual cycle after the follicular phase. The few days surrounding ovulation from approximately days 10 to 18 of a 20-day cycle constitute the most fertile phase. Rutukala. The duration between Rajadarshan to the period till conceive is called as Rutukal. It is 12 days or it may be 16 days. Ovulation failure is not only annoyance of this era, but also would be a difficulty in the ancient period. All acharyas have mentioned Bija dosha with Bijopaghata is a factor for Vandhyatva. Pathological abnormalities of Artava, a direct cause of the Bijopaghat, is described by all acharyas. Artavakshaya and its treatment, which described in Ayurvedic text, indicate both for menstrual cycle and ovulation. PCOS signs and symptoms are severe bleeding, Alpartava, that is called as the oligomenorrhea, Kashtartava, that is dysmenorrhea, Vandhatva is infertility, growing hair on back, belly, and breast, develop hair on the faces, overweight. Up to 80% of females with PCOS are significantly overweight. Acne, the skin can get higher than normal through male hormones and break out in areas such as the face, chest, and back. Darkening of the skin in body plugs, as in the nose, on the groin, and under the breast, dark patches of skin can occur. Headaches. Now coming to the management. Management in modern medicine, PCOS can be treated by following methods. Medical treatment, tablet metformin enhances peripheral tissue sensitivity to insulin, inhibits the hepatic gluconeogenesis. Ovulation inducer, clomiphene citrate, raises the circulatory concentration of FSH, gonadotropin, LH alone or FSH alone, or LH, FSH both. Ahara and Vihara. Balanced diet is essential for normal health. Weight reduction by Patya or Apatya, Ahara and Vihara. Aushadha, kapha reducing, insulin enhancing, hormone rebalancing, obstruction clearing herbs like Guduchi, Jambu, Amla, and Haridra, etc. are useful. Amapachan and Agni Dipana through Chitrakadivati, Panchakola Churna and Shadushan Churna. Shatapushpa Churna, that is the Balya, Dipana Pachana, Yoni Vishodhana, and helps in ovulation, is the drug of choice in any disease related to Artava. Vatakapha Shamaka. Next is the Kanchana Gugu. They are the Vatakapha Shamak and Pittakapha Shamak respectively. Methi, that is the fenugreek. Trigonalia phoenum gracium reduces the fasting blood sugar. Then Uttarbasti, women having amenorrhea, scanty menses, non-ovulation or useless ovulation, cases of repeated abortion should be prescribed Anuvasana Basti, that is referred in the Kashyap Samhita. Then coming to the results, the main goals of treatment should be remove obstruction in the pelvis, normalize metabolism and regulate the menstrual cycle. That is the Artha Dhatu. Drugs that help to treat the symptoms of polycystic ovarian syndrome include kapha reducing, insulin enhancing and hormone rebalancing medications. Uttar Basti is the most effective treatment in gynecological disorders. It helps to purification and clears the Artava Strota, specifies vitiated upon Vayu and improve follicular maturity. And finally, coming to the conclusion, a comprehensive approach can be adapted to cure the polycystic ovarian syndrome with Ayurveda treatment. These are some references which I have referred. And then thank you so much for the opportunity, ma'am.
Thank you, doctor. So next I invite Dr. Rujita.
Yes, ma'am. Am I audible, ma'am?
Yes, doctor.
I'm sharing my screen, ma'am.
Please share, doctor.
Is it visible, ma'am?
Yes, doctor.
Thank you. Good evening, everyone. My name is Dr. Ruchita Mandal, PG Scholar, Department of Kaya Chikitsa, BMM Nagpur. My guide is Dr. C.S. Tanmane. The topic of my presentation is Panduroga Chikitsa Siddhanta. Let us see the Chikitsa Siddhanta of Ayurveda. It has been said, Roga Madhu Pariksheta Tato Anantaram Aushadham. A physician should first diagnose the disease and then select the proper medicine. Thereafter, he should administer the therapy applying the knowledge of the science of medicine. In the administration of medicines and who knows about the modalities to be used in a therapy is sure to accomplish the desired outcome. The abstract of my study, Panduroga is described in full length by all the acharyas of Ayurveda. In Panduroga, the change in color of the body, like pallor of the skin, sclera, nail, tongue, etc., due to Rakta Alpata, that is the hemoglobin level decreased than the normal level. It is related with both important dhatus, Rasa Dhatu and Rakta Dhatu. We can correlate this disease with anemia in modern science. Anemia is the world's second leading cause of disability and is responsible for about 1 million deaths per year. Now, let us see the types of Panduroga. So it is set in Charak Samhita. Panduroga Smruta Panchavata Kapasraya Chaturtha Sannipatena Panchamo Bhakshananvrudha. Panduroga is of 5 types. 3 due to the provocation of Vata, Pitta and Kapha individually, and the 4th one due to provocation of all the 3 doshas in combination. And the 5th is due to geophagism, that is eating earth or soil. Nidan, the causes of Panduroga, it can be classified into 2 categories, Aharaj Nidan and Viharaj Nidan. So the Aharaj Nidan are following: excessive intake of Shar, Amla, Lavan, Ati Ushna, Viruddha Bhojan, Asaknya Bhojan, excessive intake of Nishpav, Mash, Pinyak, Tilatel, excessive intake of Madhya, excessive intake of body. Then Viharaj Nidan include Vidagdhana Deva Swap, having day sleep soon after having food without digestion. Then Vyayam, Vyavaya, Vega Vidharan, suppression of urges, affliction of mind with Kama, Chinta, Bhay, Krodh, Shoka, etc. Now comes the pathophysiology, the Samprapti of Panduroga. Dosha Pradhanastu Yasya Kupyanti Dhatunam Gaurava Upajayati. In whose body elements the morbid humors get provoked with pitta predominance. In that man, the dhatus grow flabby and heavy, and thereafter the complexion, vitality, and crispness, that is the sneha, and other qualities of the vital essence become excessively diminished as a result of the morbidity of
Doctor,
humans as
your
well
voice is breaking.
body elements. In consequence,
Dr.
the person becomes
Dr. Rujita, your voice is breaking.
in blood and fat and
So, Dr. Rujita, are you there? So next I invite Dr. Subi Mole. I invite Dr. Subi Mole.
Doctor, please unmute yourself, Doctor. Dr. Subhimol, please unmute, Doctor.
Hello.
Hello. Audible, Doctor. Please start the session, Doctor.
Am I audible and visible?
Audible and visible. Please start the session.
Okay, sir. Thank you. Good evening, all. I am Dr. Subi, second year PG scholar, Department of Shalyatantra, SDM College of Ayurveda, Hassan. Today's my topic is effect of Siraveda in the management of Gridrati sciatica, a case report, guided by Dr. Mahesh Kumar ES, Head of Department of Shalyatantra, SDM, Hassan. One patient came, a male patient with 39 years, on OPD by 11/8 and 2021 with complaints of severe pain over right side of lower back region, radiating to right lower limb since 4 years, aggravated since 2 months. Difficulty in walking due to pain and stiffness of right lower limb since 2 months. And his personal histories are: by diet he is vegetarian, bowels are regular as 1 time per day, appetite is reduced, and micturition regular with 4 times per day, 2 times per night, and sleep was disturbed due to pain. On general examination, his general conditions are fair and febrile. Pallor, icterus, clubbing, cyanosis, lymphadenopathy, and edema were absent. Vital signs like blood pressure are 130/80 mmHg, pulse rate is 82 beats per minute, temperature 98 degree Fahrenheit, respiratory rate 16 per minute, and systemic examinations: CNS conscious and oriented to place and person, and CVS S1 S2 heart with no added murmurs, and per abdomen it is soft, palpable, no discoloration, symmetric, and respiratory system normal vesiculobronchial sound present bilaterally. On local examination, that is of hip joint examination, inspection, no swelling and no redness. On palpation, the tenderness is present, and range of movements, flexion, extension, internal and external rotations are not possible due to pain. SLR, right it is positive as 30 degrees and left it is negative. On diagnosis, it is Gridrasi, right-sided sciatica. The treatment what we give is Sarvanga Abhyanga with Murivenna, Kadibasti with Murivenna, Sarvanga Parishega with Dashamula Gwada, Tab Brihat Vada Chindamani Rasa, 2 TAD after food, and the main treatment is Siraveda. Purvakarva of Siraveda. Tilayavagus administered for 1 anakala. On the day of Siraveda, Sthaniga Abhyangas done around the Janusandhi using Dhanvadaram Taila, followed by Bashpa Svedas of the Shamula Kashaya. And as Pradhana Karma, the patient was made to sit in a Janusama Asana, that is, on a chair of his knee height, facing to east in warm room, devoid of breeze and dust. The area around the right knee joint was slowly taped with fingers to find the veins. Siraveda is done by puncturing the prominent vein using the number 16 needle, and the blood flowing out was collected in a kidney tray till it stops by itself. There was around 100 to 150 ml blood was collected in 10 minutes. As Paschat Karma, the scalp vein set was removed and proper bandaging was done using Haridra Churna. The patient was advised to take Lagu, Rava and Ushna Aharas. As I mentioned in procedure, first we put tourniquet below the knee joint and we put one number 16 needle and started Siraveda. Around 100 to 150 ml of blood collected in kidney tray. And the result is patient got symptomatic relief from pain, stiffness, restrictions of movement around 75%. Discussion: the Gridlesi included under 80 types of Nanatmaja Vata Vigaras, and herniation and degenerative changes in the disc are the most common cause of sciatica. Acharya Charaka described Siraveda, Basti Karma, Agni Karma in management of Gridlesi. Acharya Sushruta mentioned diseases which are not relieved quickly by Snehana, Lebanadi therapeutic measures. Siraveda as an emergency management in achieving better results. The symptoms of Samyak Siravedas are Laghava, that is both body and for painful area, and Vedana Shanti, and that is pain reduction. Vishraveda Rekta stops by itself, and this case study of effect of Siraveda in management of pain of Gridlesi gave a promising result. This procedure was simple, economic, and can be done in OPD level itself. Siraveda shows immediate pain relief in Gridlesi, but still to avoid the reoccurrence of disease to break the samprapti. Thank you.
Thank you, doctor. So the
Hello, Dr. Payal. Yes, I'm sharing the screen. Mhm. Hello.
Hello, doctor.
I'm unable to share. Can you share it for me?
1 minute, doctor.
Dr. Payal, we will call you on
Yes.
after next.
Okay. So next I invite Dr. Nikhil. I invite Dr. Nikhil.
Yes, ma'am, sharing. Yes, ma'am, I'm visible name.
Yes, Dr. Visible.
Yes, Doctor, it's visible.
1 minute, sir. Good evening, everyone. Myself, Dr. Nikhil Patil. I'm PG scholar, Yeshwant Ayurved Mahavidyalaya, Kodoli, Kolhapur. My guide is Dr. Suryakiran Wag, sir. Here I am presenting a poster of Ayurvedic management of lifestyle disorders. Some selective pictures are presented in this poster. Picture number 1, bad habits. Summative picture is shown here of obesity. Hello. Picture number 2, body mass index, which gives ideas of weight management. Picture number 3, obesity, cause of obesity of shown here. Then introduction. Yes, ma'am, I'm audible. Hello.
Audible, doctor. Please continue, doctor.
Okay. Introduction. Obesity, that is a Astistolya, is considered as the Ashtonidya Purush. According to the Charkacharya, obese people suffering from various diseases like coronary heart disease, osteoarthritis, diabetes, breathing problems, etc. So detailed study of the Ayurvedic management of the lifestyle disorders like obesity is the must. Aims and objective. To study Ayurvedic management of the lifestyle disorders, obesity is important. Okay. Then materials and method, review of literature was done from Charak Samhita and online database. Conclusion. Ahar, Nidra and Brahmacharya are the 3 pillars of the Ayurveda. That is the key of the healthy life. Proper diet, exercise, proper sleep helps to overcome the lifestyle disorders. Here some references are given and solution is presented in chart view, like healthy diet, proper sleep and exercise, which leads to provide us a healthy lifestyle. Thank you, sir.
Thank you, doctor.
Hello, Dr. Nikhil.
Yes, ma'am.
Thank you, doctor. Next, I would like to Dr. Aishwarya. Please continue, doctor.
Okay, doctor. So next I invite Dr. Sunanda Matkar. I invite Dr. Sunanda.
Hello.
Hello,
Hello, doctor. Audible, doctor.
Ma'am, can you please share my PPT?
Doctor, some network problem. We will call you on after next.
Okay, fine.
Okay, doctor.
So next I invite Dr. Prajakta Kishore. I invite Dr. Prajakta Kishore.
Yes, ma'am. Hello.
You are audible, doctor. Please screen share.
1 minute.
Please, ma'am, can you share my PPT?
Sorry, doctor, we are unable to share now.
One
So
minute.
please be
1
there.
minute. 1 minute. One minute. Share. मैम शेयर ही नहीं.
Hello, doctor.
Hello. Can I start without sharing? Hello.
Dr. Sabin, is it possible? Hello, Dr. Sabin.
Okay, doctor. Okay, doctor. Please continue.
Okay, thank
Dr.
you.
Prajakta, please start.
Okay, thank you. I'm Dr. Prajakta Patharkar from the Kai Chikitsa Department, PG student, SST Ayurved College, Sangamner. My topic is Nadi Pariksha, Ayurvedic diagnostic method. Examination plays the significant role in the diagnosis of the disease. So there are different types of examination in Ayurvedic texts like the Trivid Pariksha, Shadvid Pariksha, Ashtavid Pariksha and Dashvid Pariksha. Among them, Ashtavid Pariksha was described by Acharya Yogratnakar. And these are given as under Rogakranta Sharyasyaha Sthananya Ashto Nirikshay Nadi Mutram Malam Jiva Shabda Sparsham Drik Akruti Yogratnakar. Then what is the Nadi? Means the examination of pearls. Mutra, examination of urine. In Mala Pariksha, we do the examination of stool. In Jiva Pariksha, we do the examination of tongue. In Shabda Pariksha, we do the examination of organ of hearing. In Sparsha Pariksha, we do the palpation. In Dirika Pariksha, direct observation or inspection is done. In Akruti Pariksha, examination of the whole body is done. Then what is the Nadi Pariksha? Then Nadi Pariksha comes under the Sparshanendriya Pariksha. And the diagnosis of the disease by the Nadi Pariksha is possible only by the persistent practice. Nadi Pariksha is a very simple, cost-effective and valuable technique. Then what is the location of Nadi? Where is the location of Nadi? Then Vat, Pitta and Kapha Nadi lies respectively under the Tarjani means the index finger, Vata, Madhyama means the middle finger, Pitta, and Anamika means the ring finger, Kapha, of the examining Vaidya, that is the physician. What is the correlation of Tridosha and Nadi? Three fingers placed in the position over the Nadi indicate the condition of the Tridosha and their movement like Manda, Madhyam, and Tikshna. The index finger denotes the Vata, middle finger denotes the Pitta, and ring finger denotes the Kapha. What is the site of the Nadi Pariksha? Physicians should be performed pulse examination of patient in right hand by using his right hand and use the right hand for the male patient and left hand for the female patient because it is the best felt in the respective hands. What is the Nadi Gati of respective doshas? When there is a Vatash Nadi, the Gati is like a Jalavka and Sarpa Yogati, that is the leech and snake like movement. In Pittaj Nadi, Pulinga Kaka Manduka Gati, frog like movement. In Kafaj Nadi, Paravata Gati, pigeon like movement. In Dvandvaj Nadi, sometimes slow, sometimes fast Gati. And in Sannipataj Nadi, Lava Titir Gamanam, like the busted quail like movement. So mainly Vata Pitta Kapha. Vat means Sarpa, Pitta means Pitta correlates with the frog, and Kapha it correlates with the Hansagati. So what is the importance of the Nadi? Nadi Pariksha is one of the most significant method of diagnosis in the Ayurveda. It is an ancient method, and on the basis of the Nadi Pariksha, one can draw the conclusion on the diagnosis of the particular disease and can start the management consequently. In present age, also there are many successful physicians which diagnose the diseases only on the nadi basis. Thank you, ma'am.
Thank you, doctor. So next I invite Dr. Akshat Rathod. I invite Dr. Akshat Rathod. Dr. Akshat. Sorry, there is a change. Dr. Akash Rathod. Dr. Akash.
Hello, ma'am. Hello.
Doctor, please share your screen.
1 second, ma'am. Hello. Hello.
Hello, doctor.
Hello. So 1 second.
Okay, doctor.
Hello.
Hello, doctor.
Is my screen is seeing on the desktop, sir? Hello. Hello.
Doctor, please retry, doctor.
1 second, sir.
We are unable to share now. Please retry, doctor.
Hello, Dr. Akash.
1 second, ma'am. I'm unable to present my presentation. 1 second, ma'am, please.
Dr. Akash, is it
मैम
okay?
क्या मैं इसके अगले वाला प्रेजेंटेशन ऐड कर सकता हूँ क्योंकि मेरा
Yeah.
वो आप हो रहा है मैम. हाँ.
If you are okay, then please, doctor.
Hello.
If you can, then please.
मैम मेरा वो प्रेजेंटेशन यहाँ पे एक्चुअली मैं ज्वाइन नहीं कर पा रहा हूँ.
Okay, doctor, it's okay. If you can present without the slide share, then okay, no problem.
Without the slide share. Okay, ma'am. Just 1 second. Ma'am.
Otherwise, you can take time and present later.
Can I present next to the my next person? Ma'am?
Okay, doctor. Okay, it's okay. It's okay. So next, I invite Dr. Lojan Acharya. I invite Dr. Lojan Acharya. next, I invite Dr. Avatar Singh Chauhan. I invite Dr. Avatar Singh Chauhan. So next we have a poster presentation, and I invite Dr. Manjushri Sriram Patil. Dr. Manjushri Sriram Patil. So again, next we have a poster presentation by Dr. Kavita Mukund.
Hello, ma'am. Am I audible?
Yes, doctor.
Sharing the screen. Can you see the poster?
Yes, doctor, please start.
Okay. My name is Dr. Kavita Mukund Ure from Shalitantra Department, CSMSS Ayurved College, Aurangabad. My topic name is varicose veins of lower leg. Definition: dilated tortuous and elongated superficial veins of the limb is called as varicose vein. Causative factor: genetic susceptibility, long periods of standing, long periods of sitting, pregnancy, old age, and obesity. Sign and symptoms: muscle cramping in the legs, swelling in lower legs, heaviness in lower legs, discoloration around the varicose veins, itching around the veins, burning and throbbing pain at the site. Its conservative treatment: elevate your legs above your heart when possible, maintain an ideal body weight, engage in regular light exercise, move your legs and flex your ankles to improve circulation, avoid extended periods of sitting and standing, wear support compression stocking. Thank you.
Thank you, doctor.
Thank you, sir.
Next, I would like to invite Dr. Sayali Ramdas for the paper presentation. Dr. Sayali, are you there?
So next I invite Dr. Mahandesh. I invite Dr. Mahandesh.
Hello.
So next we have a paper and poster presentation by Dr. Shekhar Dattatreya. Dr. Shekhar. So next I invite Dr. Gidu Krishna for the paper presentation.
Hello. Hello.
I invite Dr. Gidu Krishna.
Hello, ma'am. This is Akash Rathod. Can I present my?
Hello, Dr. Akash.
Hi, sir. Can I present my topic, sir?
Okay, doctor. Okay, sure.
1 second, sir. Just.
The screen is visible, doctor.
Okay, sir. 1 second. Just for. Can I audible, sir?
Okay,
Yes,
doctor. Please start.
Please continue.
Myself, Dr. Akash Rathod. I'm going to present my topic on Ayurvedic concept of immunity. Introduction. Today, the society. My topic is Ayurvedic concept of immunity. Sorry for the delay. My topic is Ayurvedic concept of immunity. Today,
Hello,
the society is.
Akash, your
Hello.
voice is very low. Please raise the volume.
Hello. Hello.
Yeah, it's okay now.
Okay. Introduction. Today, the society is facing an increase in the occurrence of new disease every now and then. Inadequacy of the modern medicine to deal with the some upcoming issues is making the world look up to the Ayurveda with hope. According to Ayurveda, strong immunity is a product of good digestion, strong Agni, quality liver functioning, and balanced endocrine system. The study include the entire relationship between Vedic Shamatva with Bal, Oja, Kapha, and now to enhance the immunity and keep body disease free by adopting Ayurvedic principles. Vedic Shamatva. It is made up to two. It is made up to two words, Vedi and Shamatva. Vedi derived from Vedi Tadena. It means Kaika, Vachika, and Mansika Pida. Kshamatva means derived from Kshamus Sahane. It means Shakti and Samarthya. Vedic Shamatva is the energy to fight or prevent a disease in a healthy body. Type of Vedic Shamatva. Vedic Shamatva नाम Vedi bal virodhitwakam Vadyutpad bal pratibandhakatvam iti. It means Vedi bal virodhitvam means destroy the disease. Vedi bal pratibandhakatvam means prevent the disease. Variability of Vedic Kshamatva. Na cha sarvani sharanani Vedic Kshamatve sarva samarthani bhavanti. Every individual has its different Vedic Kshamatva. Many people with appropriate daily and seasonal routines also develop disease, and some people, though humoured in improper things, develop hardly any disease. It due to pravar, madhya, or our Vedic Shamatva in different individuals. Factors related to Vedic Shamatva: Bala, Oja, Dhatu Sartha, Tridosh, Agni, Swasthya. Relationship between Vedic Shamatva and Bala. Trividya Balam iti, that are Sahajam, Sahajam, Kalajam, Yuktakratam. Factors responsible for Bala. Bala it responsible for Desha, Kala, Ahar Sampada, Bija Sampada, Kshetra Sampada, Shari Sampada, Satma Sampada, Satwa Sampada, Swabhav Sampada, Yavana, Karma, and Samasara. Relationship between Vedic Shamatva and Oja. Functions of Ojo. Ojo Vivruddho Dehasya Trushti Pushti Balodaya. Oja Kshaya. Bibhet Durbalo Vikshana Dhyayati Vithitendriya. Drushchayo Durmanaha Ruksha Kshamaschev Ojasa Kshaya. Relationship between Vedic Shamatva and Sartha. Vishuddha Taro Dhatu Sara Uchyate. Importance of Vishuddha Taro Dhatu Sara Uchyate. Importance of Sartha examination to understand the strength of Dhatu. Relationship between Vedic Shamatva and Kapha. Prakrustu Pratastu Balam Shleshmaha. Kapha Snigdo Guru Manda Shlashma Mrusna Sthara Kapha. So the excellence of Prakritik Shleshma in the body signifies the excellence of Ojas and indicates a good immunity. Persons having in the state of Kapha Kshaya or Kapha Vriddhi gets easily suffered with disease due to decreased level of Bala or Hina Vedic Shamatva. Relationship between Vedic Shamatva and Agni. Rogaha Sarvayapi Mandagno. Immunity is influenced by the power of Agni, digestive fire, or our ability to digest, assimilate, and absorb nutrients in the human bodies. If Agni is impaired by an imbalance within the Tridosha, then metabolism will affected. Immune response and natural resistance will also be lowered. Immunization in Ayurveda. Immunization is the process where a person is made immune or resistant to an infectious disease, typically by the administration of vaccination. Immunization in Ayurveda. There are two types: before birth and after birth. Before birth includes Garbha Sanskar, and after birth includes Bala Sanskar and Lehana Sanskaras. Any process which brings continuous positive changes in a given material, that are dravya, physical body, sharira, intellectual capacity, mana, and the personality is atma, is called samskara. There are three types of samskara. First is mana sanskara, which includes acharya rasayana sadvritta palana. Atma sanskara includes jnana, and sharir sanskara includes garbha sanskara, bala sanskara, and kaumara sanskaras. Acharya Rasayan includes Acharya Rasayan is a mode of living behavior and conduct. It is the mental hygiene envisages a code to lead stress-free life with in turns fetches longevity, which includes good mental conduct, good social conduct, good personal conduct, good moral conduct, and good religious conduct. Jatakarma Sanskar. This Sanskar conduct just after the birth. It includes three types. First is Madhu. It increases, induces active immunity, provides energy. Grata lubricates the oral mucus, wound healing property. Swarna, detoxification property, improve immunity, intellectual and memory. Lehana. Sukham dulam dukham hi balanam drishyate lehanashrayam. Similarly to the vaccination, hemostasis of dosa and to improve the immunity of the child. Provides sufficient nutrition, enhance growth and development, promote health, complexion, intellectual, speech, hand strength, protect from various infections by improving immunity. Swarna Prashan, rubbing the gold on a clean stone and then mixing it with honey, grit, and herbs. It also increases intellect, strength in digestion and longevity of the child, intellectual shrutadhara, and improve immunity. Concept of improving Vedic Shamatva. Ayurveda assigns prime importance to prevent rather than just curing the disease. A healthy immune system reduces your chance of various infectious, which with the help of some of the Ayurvedic therapies, one can boost the immune system. That includes Dincharya, Rutucharya, and Rasayana. Dincharya includes all these things, which we all knows about that. Rutucharya includes showing bala according to season. Kala, there are two types of kala: Adana kala, Visarga kala. Uttam bala. Uttam bala includes Shishir and Hemant Rutu. Madhyam bala includes Vasant and Sharad Rutu, and Hina bala includes Grishma and Varsha Rutu. रसायन तंत्र नाम व्यवस्थापनम आयुर्मेधो बलकरम रोगापहरणम समर्थ च. Benefits of Rasayana therapy includes long life, good memory, great intelligence, perfect health, youthfulness, bright complexions and color, increased strength of the body, perfection in speech, brilliance. Action of Rasayana drugs. Rasayana act at three levels of body. At the level of Poshaka Rasa, increases nutrition. At the level of Agni, increases digestion and assimilation of food. At the level of Srotasa, increases absorption of food from serum to various part of the body. Now we come to the conclusion. Ayurvedic concept of Vedic Shamata is similar as normal condition of the Kapha, Bala, Agni, and Oja. Oja is the final and excellence of the product Dhatu, and Vedic Shamatva depends on it. Production of excellence of Dhatu depends on the Hita and Ahita, Ahara, and Agni. Rasayana therapy help in produce excellence Dhatu, and lastly it convert into Oja. Ultimately increase in Oja and similarly increase the immunity. Many researchers provide immunomodulatory effect of drugs which are used in Rasayana therapy. Lehana will be also helpful in improvement of immunity. Hence, for attaining good Vedic Shamato, we should use various regimens and follow conducts as described in Ayurvedic test. Thank you. Hello.
Thank you so much, Dr. Akash.
Thank you.
Dr. Akash, are you there?
Yes, ma'am. My topic is completed.
Thank you so much, Akash.
Thank you.
So next I invite Dr. Poonam. So now I invite Dr. Sunanda Matkar. I invite Dr. Sunanda Matkar.
Hello, ma'am.
Hello, doctor.
Okay. Ma'am, I'm sharing my screen.
Okay, doctor.
But this one, Akash is...
He will stop it now.
Yeah.
Dr. Akash, please stop screen sharing.
Dr. Sunanda, please continue.
Yes.
Dr. Sunanda.
Yes, ma'am, I'm presenting. There is no. It's not possible. Hello.
Hello, doctor.
Is the screen visible?
No,
Not visible, doctor.
Yeah. I'm Dr. Sunanda, PG scholar, third year from Gomantak Ayurved Mahavidyalaya, and my guide is Dr. Mithun Bondre, Associate Professor, Department of Kaya Chikitsa. I'm going to present a case study on Kampavata. First, we will see the abstract of Kampavata. Kampavata is one among the Nanatmaj Vatavadi in Rigveda, that is Indra suffered from the disease Vepatu is the reference that we get in the classic. The word Kampavat itself suggests it is a movement disorder. The Lakshanas of Kampavata are like Karapadatala Kampa. Vata occurs due to the pathological Chalaguna of Vat. The word Kampavat can be correlated with Parkinson's disease in modern era. It is a neurodegenerative disease affecting the motor system of the body. Introduction. Movement of the signal of the radiant light, but unfortunately there are some clinical conditions is vital factors affected. Such individual becomes burden on family because they have to depend on others for their daily activities. The Kampavat is characterized with a Karapadatala Kampa, that is tremors in extremities, Tamba, that is rigidity, Cheshta Sanga, that is bradykinesia, Dehabal Brahmana, that is postural instability, and Nidra Nasha, that is insomnia. Kampavad is also mentioned in different avaranas. Acharya Charaka says avaran of Vyana by Kapha. Coming to the Nidan, that is Ati Ruksha Shita Lagu Alpa Bhojan, Bihar, that is Ati Vivaya, Ati Jagarana, Divaswapa, and Vega Sandharana. Abhigata Jana Manasika, that is Chinta, Shoka, Bhaya, and Krodha. This is the Samprapti of Kampavata. Coming to the case report, the 62 years male from Marseille weighing 44 kg come to our KD hospital on 8/3/21 complaining of Vama Hastapada Mukha Kampa since 10 years. Niyamita Mutra Pravritti, Aniyamita Mala Pravritti. He was operated for herniatomy and prostatectomy 2 years back. Drug history, capsule Sindopa 110 mg every 2 hourly and capsule Rivotril 0.1 mg 2 tabs 7 a.m. These are the Adhunik Parikshan, the reports of the patient. His MRI brain on 21st April 2017 says that there is very few small vessels, ischemic lesions in bilateral, periventricular, subcortical white matter with mild generalized cerebral atrophy, sinus thrombosis. Vitals are pulse 68, BP 110, 130/90, Malamutra Aniyamita, Akruti Krusha, and Prakriti Vata Pradhan Kapanobandi. Dushta Srotas is that Rasavaha, Purishvaha, Mutravaha, and Machavaha, and Mausavaha. Vyadhighataka, Dosh Vata, Dushya Macha and Mausa, Srotas Machavaha and Mausavaha, Avastha Jirena, and diagnosis Kampavatam. This is the treatment which is prescribed for the patient. Yashtimadu Shatavari, Kapikachu, and Ashwagandha, each 1.5 mg. Shirapak 50 ml twice a day with Brahmi Grita 10 ml morning and evening. Capsule Shirabala DS 3 times a day. Capsule Marmagutika 3 times a day. And Kavachabija Churna 3 grams 3 times a day. Panchakarma morning and evening. Sarvanga Koshna Snehadhara with Shirabala Taila and Mahamash Taila. Pancha Sneha and Tila Taila Sthanik Snehan Sweden with Mahamasha Taila, Baladi Yapan Basti and Shirabala Taila Anuvasan Basti. Nasya with Pancha Sneha and Shirabala Taila, Erand Taila Pichu Dharan at night. On examination of reflexes, deep tendon reflexes, this can be noted. Observation. Changes were noted on the 5th day and compared with those with first day with respect to Vamahasta Kampa, Kriya Alpata, Anidra, Hanukampa, Chankraman Kashtata, Brahma. There was good improvement with the functioning of the Karmendriya and reduction in the Vata Jalne Kriya. Discussion. Kampavat is one among the Nanatmaj Vata Vyadi regarding which very less detail is available in Brihatrayi and Lagutrayi. So for proper understanding of Kampavata, the general Nidan and Samprapti of Vata Vyadi has to be understood. Appropriately, Kampavat Samprapti occurs in following two ways, that is Dhatushayajanya and Margavaranjanya. Further, Dhatushayajanya Samprapti occurs in two ways. One is Majjashayajanya and other is Majjagatavata. Acharya Bhela considered that Kampa develops as a result of Asti Majjagata Vataja Roga. Kampavat is also one among the Vata Vyadi because it is characterized by Kampa. Kampavat closely resembles with Parkinson's disease, which is one among the most common neurodegenerative disorders. According to Ayurveda, brain matter can be taken as Mashtulunga Majja, which is nothing but the Majja Dhara Kala, only as stated by Acharya Sushruta. So, we can say that when there is a Shaya of this Majja Dhara Kala, it results in Majja Dhatu Shaya and produces Kampa as well as other Majja Shaya Lakshanas. So, it can be concluded that Majja Shaya and Majja Gata Vat can lead to Kampa Vata. Coming to the Panchakarma given to the patient, that is Mustadi Yapan Basti. Mustadi Yapan Basti is the best medication of choice in this disease, Kampavata, where there is Dhatu Shayajanya, Dhatvagni Manyajanya Vata Prakop. In this patient, due to above mentioned causes, there was Agni Manya leading to Avarana Janya, Dhatvagni Manya, and Dhatu Shayajanya, which leads to Mansa Shaitilya, further contributing to Kampavat as the mode of action of Mustadi Yapana Basti states its role in correcting the Agnimanya and improving the Mansa Dhatu with its Bruhan and Balle properties. Here it has contributed in solving the Dhatu Shayajanya Vata Prakopa. Sarvanga Snehan with Balataila after the Shashtishali Pindaswed also acts very effectively in this disease. Nasya with Panchindri Vardhantel, which acts on a Shrangatak Marma, also which nourishes the nerve tissues in the brain. Shirodhara with Brahmi Taila will also help in the insomnia of these patients. These are the Shamana Aushadhi and their mode of actions. Conclusion. The Kampavat can be compared with Parkinson's disease depending on symptomatology of patient. Among the various Ayurveda treatments, various Panchakarma procedures such as Snehan, Svedan, Abhyanga, Nasya, Shirodhara, Mustadi, Yapan Basti proved to be effective for treating Kampavat patients. Good improvement can be seen from the above case study. Both Shaman and Shodhan Chikitsa play an important role to improve the activities of daily living of Kampavat patients. These are the references I have drawn. Thank you.
Thank you, doctor.
Thank you, doctor. So next I invite Dr. Subi Mol. I invite Dr. Subi Mol. So again I invite Dr. Lochana Acharya.
Hello.
Hello.
श्रुति नेटवर्क में है क्या?
Hello. Hello, ma'am. Am I audible?
Yes, doctor, please start.
Hello. Myself, Dr. Manjushree Shriram Patil from CSMS Ayurved Mahavidyalaya. Hello. Am I audible?
Audible, doctor. Please continue.
My poster presentation topic is wound. Wound is discontinuity or break of surface. Simply only skin is involved. It can be complex wound, involves underlying nerves, vessels, tendons. There are 4 types of wound, inside wounds. These are caused by sharp objects like knife, blade, etc. And there is less contamination in this incise wound. Primary suturing is the first ideal treatment for this. Second type is lacerated wound. Lacerated wounds are caused by blunt objects like fall on stone, road traffic accidents. In this wound, edges are jagged and necrosis of the tissue, hematoma,
Hello. Dr. Manjushri, thank you for your presentation. So next I invite Dr. Kavita Mukund.
ma'am. Hello.
Dr. Manjushri, is it not our?
Hello, Dr. Manjushree.
Hello, Dr. Manjushri.
Okay, Dr. Kavita, are you there?
Yes, hello, yes, ma'am. Myself, Dr. Manjushri. Ma'am, it is disconnecting the Zoom meeting in my phone.
Okay, doctor,
May I
please
share again? May I share it again?
It's okay, doctor.
Ma'am, may I share it again?
It's not audible. Are you trying to say something? So next I invite Dr. Sayali Ramdas. I invite Dr. Mahandesh.
Hello, ma'am. May I share it again?
Okay, doctor, you can continue from where you stopped.
Okay. Second type is lacerated wound caused by blunt objects. Primary suturing is the first treatment and treated with other antibiotic causes. Third type is penetrating wounds. These are stab injuries of the abdomen or and are very notorious. It may look like an innocent injury, but internally organs like intestines, liver, spleen, mesenteric blood vessels might have been damaged. In these cases, patients should have admitted in hospital and
Hello, Dr. Manjushree. Again, it got disconnected. Dr. Manjushree
Yes.
has some network issues.
Yes, ma'am. It is not sharing. There is a network.
Doctor, please start from where you stopped.
Screen is not sharing. It is saying that you cannot start sharing while other participant is sharing.
It's visible, doctor. Your poster is visible for us.
मैम मेरा पोस्टर दिख रहा है. हेलो.
Dr. Manjushree.
Hello, ma'am. Is it visible?
Doctor, it's visible. It is not
Doctor,
visible.
I will share for you, doctor. Doctor, just I will share for you, doctor. Dr. Manjushree, I will share for you, doctor.
Okay, sir. Then fourth type is hello. Then fourth type of wound is crushed or contused wounds. These are blunt trauma due to run by vehicle or wall collapse, earthquakes, industrial accidents. They may cause severe hemorrhage, death of the tissue, crushing of the blood vessels. These patients are more prone for gas gangrene, tetanus, etc. Debridement is the primary procedure we always do in these cases. There are 4 stages of wounds. Wound healing is considered under 2 types: primary wound healing and secondary wound healing. Wound healing is wound healing under primary intention occurs in clean incised wound, such as surgical incision, etc. Healing by secondary intention refers to wound which is infected, discharging pus wound with skin loss, etc. Components of wound healing. There are 4 stages of wound healing. First is hemostasis. This this is up to till 2 days. Vasoconstriction takes place in the wound and blood clotting blood clotting takes place, so to prevent the blood loss from the wound. Second is inflammation. This occurs within 7 days. Phagocytic cell action induces edema, heat, pain, etc. And this in the first 48 hours, polymorphonuclear leukocytes dominate. They play the role of scavengers by removing the dead and necrotic tissue. Between third and fifth day, leukocyte diminish in number, but monocyte increases. By fifth and sixth day, fibroblast appears, proliferate, and eventually give rise to protocollagen. Third is proliferatory phase. This is a stage. This is third stage for wound healing. Formation of granular tissue, angiogenesis takes place in this case. In this stage, wound contraction takes place, and epithelialization appears. Fourth stage is remodeling as a collagen production in granular tissue. In this remodeling, collagen production may cause scar, hypertrophy scar in the wound. Then management. There are four types, and we manage the wound under four steps. Firstly, bandaging. In this case, by bandaging, we primarily undo the blood. We stop the blood. In these cases, suturing. Second is there are primary suturing and secondary suturing steps. Splint. This we do in fractures cases. Fourth one is IV antibiotics. In this case, we go for IV antibiotics to reduce the infection and to reduce the secretion of the pus from the wound. Thank you, sir.
Thank you, doctor.
Thank you, ma'am.
So, Dr. Sabin, can I conclude?
Doctor, please invite the non-participated persons. Please call and continue. Please call and conclude, doctor.
I have already called them.
Hello.
Hello, Dr. Payal.
Can I present now?
Okay, doctor, please present.
Hello.
Hello, doctor.
Hello.
Hello, your voice is clear, doctor.
Okay. Hello, myself Dr. Payal. Is my screen visible?
Not visible, doctor.
Can I present without sharing screen?
It's okay, doctor. Please start.
Is it visible now?
Now visible, doctor. Now visible.
Okay. Myself Dr. Payal from Government Ayurved College, Nagpur. My topic is management of fistula in Anovich Kshara Sutra case study. Introduction. In Ayurveda, it is mentioned that certain clinical conditions require surgical intervention for better cure. Sushruta has discussed in detail about various Kshar Karma along with Anushastra Karma, which includes Agni Karma, Jalaukacharan and Kshar Karma. Kshar is considered as one of the most important parasurgical procedure as it can produce excision, incision, scraping and pacify all three doshas. Kshar application in the form of Kshar Sutra is anorectal disease has become more popular due to its easy approach and low rate of recurrence. Kshar Sutra induce both mechanical and chemical cutting and healing. Next is Ayurvedic view of Bhagandara and Kshar Sutra. The disease which creates dharan in the area of pelvis, rectum and urinary bladder is called as Bhagandara. And when these are not open, it is called as Bhagandar Pidka. An abnormal passage between a hollow or tubular structure, the body surface or between two hollow or tubular organ is called as fistula. Kshar destroys the vitiated tissue and makes them fall off. It is the most important among Shastra and Anushastra because it does not function. It does functions like excision, cutting, scraping. Also, mitigates all three doshas. Acharya Shushruta described that Nadi Vran should be cut open by Shar Sutra, and also he said same procedure should be adopted for Bhagandara. Aim of the study is to study the effect of Shar Sutra therapy in Bhagandara, that is fistula in ano, and to enlighten the Ayurvedic Shar Karma in today's practice. The case report: patient
43 years old male patient, occupation private job, having complaint of first discharge with mild pain at perianal region since 1 year. Patient was apparently normal before 1 year, then he had developed boil with intermittent discharge in the perianal region since last 1 year. He also complained of mild pain and discomfort while sitting and continuous first discharge since 2 to 3 months. He had taken analgesics for it but didn't get any relief. Therefore, for the further management, he came to the OPD of Shalyatantra for further management. Does not having any specific history. General examination and vitals were normal. The local examination shows the findings observed where patient had hairy perianal region with a small opening at the anterior side near the root of the scrotum of perianal region approximately 6 cm away from the anal verge with pseudopurulent pus discharge through that opening. Tenderness on touch with induration was felt around external opening. Probing was done from the external opening to assess the internal opening, which comes out at 12 o'clock position in anal canal. About 6 to 7 centimeter tract was found during probing. On proctoscopic examination, no any anal pathology was seen. After complete examination, the diagnosis was confirmed as fistula in ano, that is Bhagandara. The fistulogram observations are the ischioanal and ischiorectal fossa appears bilaterally normal. Thin fistulous tract was found about 6 to 7 cm in length at left anterior perianal region. The tract shows external opening near the root of scrotum on the left side. The tract is seen extending from posteriorly towards the anal canal and show intersphincteric folds. The tract was seen communicating with the anal canal at 12 o'clock position. The internal opening is seen approximately 5 to 6 mm from the anal verge. No side branches were seen, no any perianal abscess collection noted. The external and the internal sphincters are normal in thickness. The anal canal appears normal. The levator ani muscle appears normal on both sides. Then Ksar Sutra application, preoperative, written consent were taken, part preparation was done, bowel was cleared with a tablet of two tablets of Primalax and proctoglycin enema. Injection TT was given, xylocaine sensitivity test was done. Operative procedure. Procedure was performed under spinal anesthesia. Patient was taken in the lithotomy position on operative table. After proper painting and draping, reassessment of the exigent tract, extension of the tract was done by probing. Probe was removed through anal canal via internal opening at 12 o'clock position. About 2 cm tract was laid open and Ksar Sutra insertion done in the remaining tract. Complete hemostasis was maintained and T-bandaging was done. Post-operative procedure includes broad spectrum antibiotics and analgesic along with Ayurvedic medicines, and Sisbath was given for 3 to 5 days. Patient was admitted to the hospital for 5 days till the next Ksar Sutra was changed. Patient was advised to take high fiber diet during hospital stay. He was also advised to resume his normal day-to-day activities. Patient was discharged from the hospital after first Ksar Sutra changing and then asked for the changing Ksar Sutra every 5th day till the cutting of the tract. Hot seeds bath with the Karpur Grita local application was done during the period. Patient was allowed to do his routine job after discharge from hospital. After 10 sittings, the tract was totally cut and healing was achieved simultaneously. These are the images during the procedure. Discussion. Shushruta described the treatment of fistula in ano as Bheshaj, Sharakarma, Agnikarma and Shastrakarma. In modern medicine, treatment like fistulotomy, fistulectomy, sit-on ligation are indicated. These treatments have more recurrence rate and post-operative complication like hemorrhage, pain and delayed healing. In comparison to the modern treatment, Ksar Sutra ligation is better due to its minimal complication and less recurrence. Even fecal incontinence and anal stricture are not seen in this case. The application of Ksar Sutra is having anti-inflammatory and antimicrobial property, and due to its alkaline property, helps in cutting and healing. Cutting mainly occurs due to local action of Ksar Snuhi and the mechanical pressure of Ksar Sutra knot. Haridra powder having antiseptic action helps in the healing of the tract.
Conclusion: the incidence of fistula in ano is increasing nowadays due to improper job style where a person sits for long time on hard surface. The management of anorectal diseases needs to complete knowledge of the anorectal anatomy and physiology. Also, it needs to be diagnosed early so that appropriate treatment can be given without delay. Char Sutra helps in the removal of debridement and also prevent from bacterial infections. Char Sutra at time provides both cutting and healing, so we can use it any type of fistula tract. So we conclude that fistula in ano Char Sutra treatment is better option to minimize the complication and patient can resume normal activity earlier. Thank you.
Thank you, doctor. So finally, I invite Dr. Shekhar Dattatreya. Then Dr. Gidu, are you there? So thus we come up to the final end of this 3-day presentation. So before going to the end, I would like to express my sincere gratitude to our panel members, and all our participants did very well. I wish them good luck. We'll see